What's that look like? Oh, that's the thing.
Good evening, ladies and gentlemen. Hour is 7 o'clock, and as mayor, I hereby call to order this special meeting of the Laconia City Council for June 15, 2015. Do we need to call the roll for a special meeting? I'll just note for the record that all 6 councilors are present tonight and a quorum is established. And our primary order of business tonight is to hold further meetings with department heads in terms of advancing the fiscal year 2016 budget. And then we do have a small amount of business afterwards having to do with the announcement made this afternoon about the Belknap Economic Development Council's purchase of the Colonial Theater and the city's participation in that arrangement. So first up tonight, we're going to be talking to the fire department. I see Chief Erickson in the audience. I see Chief Hayes.
Good evening, everybody. Thank you for the opportunity to present the budget. I'm going to start, though, by presenting Chief Jim Hayes of the Lakes Region Mutual Fire Aid Center. I know there were some questions about the Mutual Aid Center.
Good evening. Thank you for the opportunity to just address the council and give you a little bit of background information about the Lakes Region Mutual Aid System. Back in the early 1950s, the fire departments in the Lakes Region area and a little bit beyond, most of them got together to begin discussing how they could really deal with shortage of resources, manpower, equipment, and how they could help each other be able to more effectively deal with the fire emergencies that were happening in the area. And that was really the beginning of the Lakes Region Mutual Fire Aid System. 1951 is when the organization was officially established and continued on for the next 64 years to where we are today. And we continue to address the shortages of resources with manpower and equipment and how we can effectively support one community to the next in dealing with the ongoing emergencies that happen on a daily basis. In the late 1960s, the mutual aid system began talking about the need for establishing better communications. Prior to that, it was very limited radio communications. Some communities had radios, others didn't. The city of Laconia, being the largest department in the area, was kind of the communications hub, even though they didn't have direct communications with all the departments. So discussion began of how they could better deal with communications issues, and that is ultimately what brought the Lakes Region Mutual Aid Communications Center into being in 1971, when the centralized dispatch was established and began pretty much the foundation of the organization that we are today. The biggest part of that is at that point in time to establish a centralized dispatch meant you had to have employees. So that was the beginning of hiring employees to staff the communications center, and that really is the focal point, or I shouldn't say focal point, it's the central point of service that's offered through the mutual aid system today, is centralized communication for 35 communities, for the fire and EMS agencies within those 35 communities. We deal with call taking primarily from the 911 center. We do get some direct dial emergencies that come into us. Most of those are people that have been around the area long enough that they predated 911, so they still remember the 7-digit phone numbers, and they still call us on the 7-digit number. We don't publish it anymore, but it's still maintained because people are still aware of it. So that's the biggest thing that we do as far as service delivery, but that's also the part that costs the most as far as operating the mutual aid center, because it's staffing, and it's developing and maintaining, a wide area communications network. And there's a lot of technology that goes on in that. The services that we provide is 24/7 emergency dispatch. That's kind of the nugget, because everything starts with that. When a person has an emergency, they have to call for help. We process that call and get it out to the appropriate agencies that are going to respond to that. We do that utilizing a computer-aided dispatch system. We worked for, as technology progressed, we were generally behind the curve, but that's okay. We went from literally Rolodexes that held street addresses and street names and directions to it was a computerized Rolodex for all intents and purposes. The data that we had on the Rolodex, we were able to get it put into a computerized database for lookup purposes. And just within the last couple of years, we were able to move into using a computer-aided dispatch system. What that really does is that gives us the ability to process the calls faster, but it also gives us the ability to be able to provide detailed information to the responding units. When we receive a call from 911 now, we put the address into the system and it displays the location of the incident on a map. So we can tell where the incident's located, what the cross streets are just by a look at the map. If there are hydrants in the area, we can tell responding units where the closest hydrants are to the incident. And we can also put information flags on particular addresses. I know Chief Erickson has worked with my dispatchers in identifying a number of properties in the city where there are particular known hazards, and we can put an information flag on there. So when that address comes up, it gives a warning to the dispatcher. The dispatcher can pass that information on to the responding units. So it not only helps us to process calls faster, but it helps us to provide very useful information to keep the responding units safer when they do arrive. We're operating on like I said, a wide area communication network. We use 11 different remote transmitter sites, and we now have a state-of-the-art radio dispatch console that we just finished getting installed. And that in itself allows us to, by using what's called a simulcast system, we can bring up all 11 transmitters at the same time, and it gives us a better wide area dispatch. Prior to that, we had to pick which individual tower we were going to use talking to particular units. Some of the other things that we can do as far as supporting departments in the field is coordinate their mutual aid response tables. We work with the chiefs to determine which units they want to have coming for what type calls, and that can vary from different parts of the community. It can vary based on the type of incident. It can vary based on time of day and day of week if that is the need that needs to be met. And that's all done through that computer-aided dispatch system. Other things that we can do is a lot of times we will provide incident command support and communication support at the scene of a large incident. One of the things that an incident commander really doesn't need, they need to pay attention to communications, but they need to focus on the incident. And if they're trying to focus on the incident and try to listen to the radio at the same time, things get missed. So we provide field operations for that on large incidents. We'll respond to the incident scene. We man the radios at the command post, monitor, and kind of filter the communications. We don't make the decisions, but if it's something that immediately has to go to the incident commander, it does. If it can be dealt with by somebody else, we hand it off to them. A couple of the other lesser services, if you want to call them that, they're more in the support level service. We do provide self-contained breathing apparatus face piece fit testing. It's quite a name, but fit testing is the short version of it. For safety of the personnel, annually they're supposed to have the face piece of their SCBA fit tested to make sure that it fits their face properly. The mutual aid system a couple of years ago purchased the equipment to be able to do that testing. And well, for the city of Laconia, I believe we bill you $150 a year, as opposed to prior to that service being available, it was generally anywhere from $35 to $45 per person coming from a third-party vendor. So the system felt that that was a useful service that was available to all the communities in the system and would be certainly an economic benefit to each of them. By virtue of being a member of the Lakes Region Mutual Aid System, each community member also has service by the Central New Hampshire Hazardous Materials Response Team. It's very difficult for any community to establish a hazardous materials response capability on its own. It's very expensive, it's very time-consuming. So the Lakes Region Mutual Aid System and the Capital Area Mutual Aid System joined in a joint venture and established the Central New Hampshire Hazmat Team. And it's a Class A rated team, meets all the NFPA and EPA standards for level A responses. And essentially, they do it all through grant funding. It's not funded, it's one of 9 hazmat teams in the state of New Hampshire, and it's the only one that does not have any funding from municipal budget. It's all done by grant funding or user fees. So that's a very beneficial service to have. We also offer training programs. We have some limited radio programming capabilities. We're not a radio shop, but we have the ability to program portable radios and pagers and things. And we monitor the city's master box system. So that all takes place up at our office, up on the old state school property. We're in the Dwinell building. If you enter into the property, we're the first building on the left. And there's somebody there 24 hours a day, 7 days a week. So if you can't sleep some night and want to go for a visit, if you push the doorbell, tell them who you are, they'll let you in, give you a tour. But the place is always open for visits. Anytime somebody wanted to come up, we'd be happy to give you a tour of the facility and show you how and what we do. That's a real nutshell description of who we are and what we do. Probably better if I can answer questions that might be a little bit more specific to the information you were looking for. So,
Any questions for Chief Hayes?
Can you talk a little bit about you talked about the good work that you do, and can you talk a little bit about the financial management of the entity? And, we get sort of a single line item and say, let's pay the bill. Can you walk us through the sort of financial management of it and
okay.
different
Yeah,
aspects of that to,
we are kind of almost like a utility bill. It's, here's the bill. Our governing body is made up of a board of directors. There's a director from each of the 35 communities that makes up the mutual aid system. So that's our overall governing body. Then there's an executive committee of 5 directors that make up the executive committee. And then I function as the day-to-day manager of the organization. The way our budget is structured is we put together what we anticipate for the operating costs for the coming year. And then we apply a 3-part formula to the operating portion of the budget. And the formula is based on, we take 10% of the budget and divide that equally amongst the 35 communities. Then we take 40% of the budget and we apply the equalized assessed value of each of the communities to get that 40%. And then the remaining 50% is based on population. Now, the numbers that we use in calculating our budget are always 2 years in arrears because we get them from the state of New Hampshire. So as we begin to develop our 2016 budget, the newest assessment numbers that we have available to us are 2014. So that's why we're always 2 years behind. And so that's how we put together the operating portion of the budget. And then starting in 2015, there's a capital improvements component that's separate from the operating portion. That's a flat figure that's equalized throughout the system, so everybody pays the same amount. As far as management of the budget,
Make sure I understand it. When you
Certainly.
say everybody pays an equal amount, you mean based on assessment, or Laconia pays the same as Gilmanton?
On the capital improvement, Laconia pays the same as Gilmanton. Yeah. For infrastructure costs, and this is a position that the Board of Directors took in 1998, when they started to build the current communication center. They took the position that that type of infrastructure cost needed to be equal across the community members, because infrastructure is needed by every single person.
So we're paying 1/35th
Yes,
infrastructure.
yes. For infrastructure costs, you're paying 1/35th.
What's the total budget?
Total budget
Your
for,
total. Ours is 129,000. So what
the
we.
total budget for 2015 was $1,187,119.
So our percentage is
Just about 11%.
11%.
Yep.
Thank you.
Sorry.
As far as the day-to-day management, yeah, that rests with me as far as paying our bills. And then the executive committee reviews them on a monthly basis to make sure that we're staying on track as far as, budget management and stuff. As far as the process of gathering our revenues, each year, just after town meeting, because with the exception of 5 communities, everybody else operates on a calendar year budget. So right after town meeting, we send out the assessments to the communities and bring in our revenues that way. And then for the city of Laconia, the town of Plymouth, town of Samerton, and the city of Franklin, and the town of Samerton. They're all on fiscal year, so we bill them in July. So they're, Holderness was the other one. They operate on a fiscal year, so just their billing cycle is just a little bit delayed from the others. That's how we generate our budget and how the assessments are distributed.
Go ahead. I'm sorry, Counselor Hamlin.
Thank you for coming, really appreciate it.
Sure.
Told us, need some information I didn't know of, so. How many people work at Mutual Aid?
There are 8 full-time dispatchers. There are 8 per diem dispatchers. And then there are 3 part-time administrative staff.
19 people. So the 3 are what, secretaries, or?
Now, that would be me.
Oh,
I'm a part-time employee.
Okay,
The deputy is a part-time employee, and our IT manager is a part-time employee.
okay,
I am the secretary.
okay. Since this is your first time here, and hopefully you'll be able to come back every year, kind of have to ask some of the questions, but do you have, or can you get us a copy of your budget, a broken down budget of like salaries and expenditures and things like that? Is that, you must have a budget that you prepare?
Yeah, I have a budget that I prepared. You mean just a regular line item as to how much we spend in each line item? Yep. We provide that to the chief of each community every year as we develop the budget.
Oh,
So
okay.
that's readily available,
Do you budget on a calendar year or fiscal year?
calendar year. Yeah, I will present the proposed budget for 2016. I'll present that to the Board of Directors in September. And then either late October or very early November, the Board of Directors will vote to approve that budget or amend it, as they did this year. Because so many of our communities have to have that number to put into the municipal budget development by November to meet their timeframes. We're starting early to get ours developed.
You said that, what is it, 38
35.
35 communities, yeah.
and they're on a board of
Yes.
some sort? Are they,
There's a director for
are
each
they
community.
municipal employees, or how does that,
Well, fire chief.
The majority of them are fire chiefs.
all,
No, the majority of them.
Majority.
We have 2 selectmen on the board,
okay, and then your, what was the other one that you called, your 5-member,
the executive committee.
and who was that made of?
They're fire chiefs from the board of directors.
Is it one man, one vote, so to speak, on the board?
Yes,
So Laconia has 1 out of 35 votes?
correct. Yeah, each community gets one vote.
Counselor Littman?
I remember at one point, there was some relationship with your budget and the county administratively, at least, and that was sort of carved out, to my understanding. Are you standing independently of the county, or are you still getting some of your benefits and things through them? What's the relationship with the county now?
We are completely independent from the county now. The relationship with the county actually started at the formation of the communications center, in the need to basically bankroll the operation. The first year, the county bankrolled the whole thing and paid the expenses of it until they could, generate a budgeting process. And after that, the county would basically front the money and then collect the assessments at the end of the year and replenish the county coffers. And over time, that changed to the point where the county would then take the assessment for the 11 Belknap County communities, and they would pay Lakes Region 6 equal payments over the first 6 months of the year. And basically, that established the cash flow that was necessary to run the operation until the assessments came in from the other communities. But then, over time, as times changed, processes changed, people changed, we began to have less of a good working relationship with the county as far as the financial aspect of it. It got to the point where the county would say that they were overseeing the budget because nobody else was doing it, which is not true because every single community has some input into the budget. But once the county decided, and they realized they could only impact the portion that pertained to Belknap County, which at the time was roughly 50%. If they made an adjustment to that 50%, you had to make an equal adjustment to the other 50%, otherwise you had unequalized assessments. And that really began to create some problems. And within the county structure, the county uses a different funding formula than what we were using. So we would generate an assessment for each community, send it to the county. They would get the itemized assessments and then a collective assessment. And they would take the total amount and put it into the county budget and apply it to a different assessment formula, which resulted in some communities paying less than they would pay if they paid Lakes Region directly, and other communities were paying substantially more than what they would have paid Lakes Region if they were paying directly. And that's when the community said, okay, we've had enough. We want to pay directly to the Lakes Region so that there wasn't an unfair assessment. And it actually worked out better for us in terms of some of the dynamics of the board of directors, because some of the directors from outside of Belknap County felt it was rather unfair that the Belknap County chiefs didn't have to go justify their budget to their local communities every single year, and the other 26 communities, or 24 communities, had to. So now everybody's on the same playing field. Every chief has to go justify his budget to every community.
Go ahead.
So in terms of like benefits and salary levels, how are those arrived at?
We do all of the legwork on all of that ourselves, which takes a lot of time. We operate on a 6-step pay scale, from beginning to top step, and we do a comparative analysis every few years with other communications centers, and we're not at the bottom, but we're not even really at mid-level. We're between bottom and mid-level as far as average pay scale. A lot of the communities that we compare with we compare with this capital area, but their dispatchers are actually employees of the city of Concord. So they're in a higher pay bracket than we are. We compare with Grafton County Sheriff's Department because they're a similar size organization, but they do both fire and law enforcement, so they're a little different than we are. And they're in the county pay structure, so it's all determined by their collective bargaining agreement.
Forgive me for the ignorance of this question. What technically kind of organization are you? Are you a private,
We are a municipal corporation.
municipal corporation? Okay. And in terms of, one of the things that we've been trying to stay a couple steps ahead of is the health insurance costs and how that ties to potential Cadillac tax liability. Are you guys doing anything to manage that?
If you have a golden bullet answer, please share it with me, because we're struggling with that, trying to figure out how we can deal with that. We use the Municipal Association, the LGC, is our healthcare provider, and we're working with them to figure out what they're going to do as far as provisions
So
of healthcare.
you know what you're paying ballpark for a family policy now?
Ballpark is roughly $25,000. It's 25 and change.
That's the total bill.
Yes. And we do a split. Right now, employees are paying 80, we're paying 89%, they're paying 11%, and we're increasing that 1% each year till we get to at least 15% and see where we are then. Because
And
health
this
insurance
this
a
is or
huge-
is not a collective bargaining,
It is not.
is not. Counselor Henry?
Just curious, someone that comes in at step one, or what's their salary for that? And when they reach the sixth step, what would that be?
I didn't bring the pay scale with me. I know a new full-time employee, full-time dispatcher, starts at $15.75, so that puts it at roughly $34,000 salary. A new dispatcher, if there's a family plan, healthcare with it, total compensation, employee compensation is $71,000 a year for salary, benefits, the whole package
The
is
starting person?
for a starting person, yes. A top step dispatcher is making, and I apologize, I don't have the pay scale with me, but they're making roughly between $21, $23 an hour, and the benefits are the same, so,
21 to 23 at the top?
at the top, yes.
We can obviously get those numbers.
Yes, yeah, I have them, I just don't have them with me.
Very good.
Further questions?
Thank you.
Thank you, Chief. We appreciate your being here.
You're welcome. And as I said, if anybody would like to stop up sometime and see the operation, you can either have Chief Erickson arrange it, or just give me a call directly. Hand them out this information.
Thank you, Chief Hayes, for coming.
Could I ask you a quick question first?
Certainly.
He said that you have the breakdown of their budget, or
Yes,
so could you make that
I
available?
will get it to you, yes.
Thank you.
Yes. The Mutual Aid Center, I've worked in 4 departments, 2 states, and by far, this is the most exceptional system I've ever worked with. MRI actually referenced it several times in their study, how efficient the system is. Its regionalization to a grand scale, it's covering an area almost the size of the state of Rhode Island. And I want to point out, we bill out $60,000 a year to monitor our master fire alarm boxes. They do that for us. They also monitor all our sewer plants through the fire alarm system as well. So anytime there's a problem in any of our sewer plants, the Mutual Aid Center is actually the people that contact the sewer department to let them know there's a problem in our sewer plants. Our fire insurance rate is a Class 3, which is only 5 in the whole state that are Class 3 on a scale of 1 to 10, 1 being the best. And one of the significant reasons that we have such a great fire insurance rate is because of the score of the mutual aid system, as well as the score of the waterworks and the fire department. But it's a threefold system: your communications, your water supply, and your fire department. And there's no question, they, I believe, scored 70% of what they could score. Waterworks was closer to 80%, and then the fire department was about 60%. So our lower fire insurance premiums directly attributed to that system. I want to thank Chief Biotti for showing up. He was actually at the middle school for graduation tonight. I was going to tell you that he couldn't get here. Which button do I push, Mary? Okay, almost shut the system off. Just like to always remind everybody, the reason we exist is to save lives and property from fires and man-made and natural disasters, and to provide emergency care to people suffering from sudden illness and trauma. People call us when they're having the worst day of their life. They expect us to arrive promptly, be prepared, professional, and to help fix their problem as best as possible. Last year, we responded to 3,896 emergency calls. We're already 16% above that this year. Our workload has just been astonishing this year, and we're just getting into our busy season. Our strategic goals generally haven't changed in the last 2 years, but I just want to bring them up again. Improve incident response through training, staffing, and mutual aid, enhance firefighter safety, strengthen the officer corps, improve community involvement and preparedness, and improve emergency planning. We're doing this by increasing training hours specifically for fire suppression, fire behavior, and building construction. Building construction is a major issue in the fire service because we're bringing in so much new construction that is basically lightweight components. Buildings being built today, people might think they're actually stronger than they were, but with all the lightweight components, they're actually weaker in a fire. We review all our injuries, and we issue an advisory report for every injury on top of what the City Safety Board does. We conduct thorough after-action reviews of every major incident, and Chief Biotti then issues a lessons learned, and he reviews it with the individual shifts to talk about what went right, what went wrong, and what can be done better. And then we have improved our direct supervision and overall command and control in all high-risk operations, and part of that involves either Chief Biotti or myself making sure we get to serious calls. And then we're maintaining just a constant focus on safe operations. As you know, we had one of the worst injury rates in the system, and we have dropped our injury rate by 78%. Performance objectives, we want to get the first unit on scene in the built-up areas within 6 minutes, 80% of the time. We want to get the first unit in the rural areas within 10 minutes, 80% of the time. We want to reduce wear and tear and road time on apparatus. We don't have a specific number on that, but we're always trying to keep these big trucks off the road. We want to improve our cardiac arrest survival rate to 30%. I do want to comment that since Friday, we have had 7 status 1 patients. All 7 have been revived. One was a near drowning Sunday afternoon in the Weirs, a middle-aged woman, and she is alive. I don't know how well she's doing, because once we transport them, we kind of lose touch on them. But 7 status 1 patients in 4 days. We want to try to control 60% of all our dwelling fires, and I mean single-family homes when I say dwellings, with a first alarm assignment, and we want to inspect high-risk properties every 2 years. And the initiatives we have started, and again, these are continuations, but safety inspections are based on the at-risk community. We just don't randomly go out and inspect every single building in the city. For one, there's too many buildings to inspect. So we looked at where the problems are, and we know the problems are in multifamily dwellings, and we know the real risk in the community's public assemblies. So those are the places that we focus our attention on. There's over 110 assembly occupancies in the city of Laconia. In-service inspections of commercial properties are done by the on-duty crew. They did do 39 buildings last year, 39 properties, and that was closer to 50 buildings. Because if you think of certain properties, you might have a marina that is considered one property that could actually have 6 or 7 buildings. Increasing emergency planning. We do extensive planning every year. We've just spent lots of time planning for concerts in the Weirs. Unfortunately, they got canceled. We're putting a lot of time into planning for Bike Week. Even though it happens every year, we still have to go over the plans. We're working on Pumpkin Festival, which we're very excited to see happen in the city. Safety awareness for senior citizens and young children. We know statistically that in fires, they're at the greatest risk, but also for trauma, senior citizen children are also at the greatest risk. So we spend a lot of time, especially on the senior citizen side, trying to promote fire safety and fall safety. And then we no longer do dive rescue work. We're strictly focused on surface water rescue. Just last month, we had 13 firefighters take a 3-day training program on rapid water rescue, basically river rescues. All 13 firefighters volunteered to spend 3 days in the cold water learning how to do river rescues. And I think that's commendable to all of them. And it's a reflection on the whole department. We would have had more, but people did have to work and protect the city. We're still a small city with big problems. We now have 17 buildings over 4 stories high. We added a 5-story building to the rolls this year. Most of those buildings are not protected. In the downtown area, very few have any fire protection. Nursing homes, hospitals, elderly housing, residential board and care, 1,100 multiple family dwellings, which is 48% of the population, and it's 36% of all our fires are in multifamily dwellings. On a national level, fires in multifamily dwellings are 15%. So we're over twice the average, and it's because we have such a high number of population living in these buildings. We have large fire hazards, marinas, fuel depots, business blocks. The downtown business block historically has burned down many times in its history. Most of our homes were built before 1960. They're very combustible. A lot of them have been converted into multifamily dwellings, which just compounds the problem. And then they're all very close and spaced very close together. The core area, buildings are densely populated. It's not uncommon to go to an apartment house and find 25 people in one building that was probably built for a family of 5. You can have a building on a corner downtown Laconia with 200 occupants in it. This particular weekend, we have another high-rise on the opposite corner that probably has several hundred people in that building this weekend. And we have to be able to deal with that. We obviously have an alcohol and drug abuse problem. Literally, an hour before I came here, they saved a man from a heroin overdose, literally an hour ago. Domestic violence is also a problem. And interestingly, we are probably, right now, sometime this month, going to reach 10,000 living units, which now puts us above Keene, above Londonderry, and above Hudson for living units, yet our population hasn't changed. They have 24,000 people on average. They respond to 3,100 emergency calls on average, and they, on average, have 9,100 living units. We are any day now going to break 10,000 living units. We're at 3,900 emergency calls, and yet we only have 17,000 people. And I bring this up all the time, but the census is not a true reflection of the city of Laconia. Highlights year-to-date, right now, I pointed out our performance objectives. Our response time citywide is 84% of all our calls within 6 minutes. The built-up areas, we're at 88% within 6 minutes. We're at 64% of all our calls in 4 minutes in the built-up areas. In 2009, that was down to 47%. So we're getting to our emergencies much quicker, which is critical in our work. Recalls have dropped significantly. We were having a ratio of 1 recall for every 15 emergency calls. We're currently at 1 recall for every 80 emergency calls. The May that just ended was the busiest month in the history of the Laconia Fire Department, 405 emergency calls. I have no valid reason why May was so busy. It should be normally a quieter month. But I decided if we had not had the 4 SAPA firefighters, I look back throughout May, we probably would have had to put 30 recalls in if we had been running with less than 9 people on duty. And
Explain to me what a recall is.
when this pager goes off,
Yeah,
and it says Lakes Regional Laconia Emergency Recall, we're calling in off-duty people to supplement the on-duty crew. And if you're within 20 minutes of the city, you're eligible to come back. You get a 2-hour minimum pay. We do that for every major emergency, such as a building fire or water rescue, and we do that when we've hit the point of no return, when we have nobody left to go to calls. We were doing that on a 1 to 15 ratio. We're now only doing it 1 to 80. So we've cut the overtime by that by about $60,000 to $70,000 from the rate it was 2 years ago. But in May, we probably would have had to put 30 recalls in the month of May based on the amount of calls we had.
and do you attribute that to the extra firefighters that we've had?
There's no question having 9 people on duty has a major impact on that. Having the hospital so close where we can turn ambulances around rapidly also has a major factor on that.
Okay, thank you.
But having 9 people on duty allows us to put 3 trucks out of the center station at any given time and get a truck out of the weir station, and that happens frequently. So yes, having the 9 people on duty does make that big of a difference. Injuries are down 78% since we've hired the SAPA firefighters. We went from $143,000 a year in lost wages and overtime to $34,000 this year. Inspections are up significantly by the fire.
What's that connection?
I can't honestly say it's all attributed to the extra people. I think a lot of it is the focus on safety, the focus on, the training that we're doing. There's some significant luck involved, because when you look back on some of the fires we had in that period of time, we had 13-hour events with no injuries, and that 9 people on duty really would have only impacted that within the first 10 minutes of that fire. Again, the focus of the officers on preventing injuries and watching people, direct supervision to, instead of trying to be outside running an area of a fire, you're with your crew, watching them to keep them out of trouble. And it's very easy for firefighters to get in trouble in a burning building because they can only literally see a couple feet in front of their face. So having that officer doing direct supervision, standing behind them, so to speak, especially with a thermal camera, seeing the conditions changing, he may be able to say, hey, we got to back out of here before we get in trouble. So, and it just could be an anomaly, I'll be honest with you, Mr. Mayor. Inspections are up not only by fire prevention, but by the duty crews. As I mentioned, they did 39 properties last year. Fire prevention did 42 multifamily dwellings. I'm not happy with that number, but unfortunately, it's so time-consuming between inspecting the property, going back to re-inspect the property, having the landlord not show up, and then go back in to do the follow-up inspection. When we got 42 buildings done. We now have 2 part-time inspectors working, so we're hoping to ramp that number up. But when you look back over the last probably 3 or 4 years, we've done about 200 multifamily dwellings. Apparatus use is down because of the fact that with more people on duty, just as an example in the Weirs, we don't have to send the central ambulance to the Weirs. With the added staffing, we can send 3 people on a truck instead of having 2 trucks with 2, as an example. One particular area in very, very noticeable was the Weirs engine. The mileage on that truck dropped dramatically to the point where it was 2 less preventive maintenances a year. Now, preventive maintenance on your car is probably a $50, $60 operation. A preventive maintenance on a big fire truck is a $500 or $600 operation. And then the added length of the tires, to replace tires on a fire truck is a $4,000 operation on a fire truck. It's an $8,400 bill for the ladder truck. So the more and more we can keep these trucks in the stations, the more money we're saving, not necessarily in the fire department budget, but in the city budget overall. And part of that apparatus use is, with 9 people on duty, we can send a personnel in a staff car to go do an inspection instead of taking a big fire truck, which obviously saves money. Training is up significantly over the course of the year. Training is up significantly over the course of the last couple of years. What's interesting, though, right now, 2015, calls are up 16%. And looking at the statistics, I can't point to, it wasn't the extreme cold, was it the extreme dryness of May? Just in general, calls are up 16%. At the current rate, we're going to do 4,200 emergency calls in the city of Laconia this year, which will probably make us the 7th busiest fire department in the entire state of New Hampshire. Calls at night are up 13%, and that's pretty remarkable. And again, a lot of it has to do with, I hate to say this, but what's happening in the city after dark. And these type of situations that end up getting to be police operations invariably become fire department operations, whether they're assaults, domestics, or drug or alcohol problems. Multiple calls as of right now are up 39%. Overtime savings for fiscal year that we're currently in, ending June 31st, I'm projecting we're going to return $80,000 to the city. We did $70,000 last year. So we've had even though everything is through the roof, we've still managed to save $80,000 to put into the reserve fund.
Do you have a question, Paul?
I do. Chief, is there a uniform definition of call? Is there, I guess, a question we might have, is there call inflation in some fashion by how calls are being defined? Do communities define the call the same way?
No.
Have we changed our definition of call?
If we get dispatched by the Mutual Aid Center or the police department through 911, it's an emergency call. There are communities that will make calls. If they go plug out a fire alarm box, they'll call that an emergency. They'll call that an incident. That's not an incident. We do 3,896 emergency calls last year. We did 9,697 services last year. So that's, whenever someone asks us to do something all combined, it was 3,896 emergencies and then the 5,000 non-emergencies. So that would be inspections, public education, fire extinguisher training, drawing a blank, what other, a lot of it is inspections. But that's all the other stuff we do combined. So we're doing just under 10,000 services a year, 3,896 emergency calls.
So like when we're comparing ourselves to Keene or Hudson, it's fair to say that the volumes on emergencies at least are apples to apples?
I actually make it a point to look at their reports to see what they report. And there is one community that I don't include in our survey because of the fact that they're generating work. And I don't believe in that. We don't need to generate work. We don't need to generate numbers. We do enough emergency work without making numbers. I mean, I know departments that when a mutual aid truck comes into their community, they make that an incident for them. And that's just false. If mutual aid unit comes into Laconia, that's just part of our first call. We don't make a second call for that. So no, we don't make calls. 3,896 times last year, someone called 911 and said, I'm having some form of emergency. Now, what level those emergencies are, they can vary. But most often, when people do call us,
That would be my question. Do you have a follow-up question? Do you break those calls down by their letter grade?
I can, give me 1 second here. Whoop. Just as an example, 2014, we did 380 reported fires, 125 actual fires, 54 fires in structures, 60 fires outside property, which would be brush fires, rubbish fires, 11 vehicle fires, 2,646 medical emergencies, 243 hazardous conditions, 471 public assist or good intents, 411 fire alarm activations, and then I've added in, these are not considered incidents, but we did 62 recalls, 1,635 multiple calls, total services with 9,696, and then emergency request was 3,896. And if you look far to the right, you can see like since 2009, reported fires actually went down 15% this year. But when you look at the trend, I don't know why it dropped, but it's been going from 438 upwards, and then this year here it dropped. Just like actual fires, we were at 96, 111, 136, 148, 140, down to 125 this year. Structure fires dropped this year, but we still have one of the highest structure fire rates per 1,000 in the state of New Hampshire. So that's the, that's the type of calls we go to. I can tell you, like status 1 and 2 patients, which are life-threatening, near-death medical emergency, are, was it 15%? It's 15% of the 2,846 medical emergencies.
Okay, so my question, I guess in layman's terms, would be, of the 2,600 medical calls, do we track how many of those are what dispatch would call Alpha or Bravo level?
Yes, we do.
And what's that number?
I don't have it with me, but it's a significant number. There's no question about it's a significant number. And I don't know if, we do not respond to emergency traffic to an Alpha call or actually a Bravo call can be anything if they don't have good information. But an Alpha level call, we don't even put lights on. When you see us driving around the city in the ambulance and people are like, where are they going? They're going to what is considered by the person calling to be an emergency, but we don't actually, it's part of the 3,896, but we actually go what we call with traffic, based on the 911 interpretation of the call. And a lot of these calls are through nursing homes. Nursing home will have a hip fracture, as an example. Now, this patient needs to get to the hospital. They need to go in an ambulance, but it's an Alpha level patient. So we'll respond up there with no lights and sirens. We do a tremendous amount of work. Unfortunately, we have, without naming them, we have multiple medical facilities in the city. So we go to a lot, they're on their 3rd medical call since I've been standing here right now. But we do a tremendous amount of work to St. Francis, Taylor, the county nursing home, Genesis up on Blueberry Lane, and the mental health facilities on North Main Street. We do a lot of work in those places that fall into that category of emergency calls, though. Yes?
On the reported fires and the actual fires.
Yes.
Is that like what you would consider a false alarm?
No, no,
Trucks roll
no, no.
out and
Someone,
There isn't something there?
380 times last year, someone called up and said there is a fire, some type of fire. And there was 125 of those were actual fires. I smell smoke in a building. All right, we get there and it's, it's a toaster with burnt toast. It came in as a fire, actual fire is 125.
When you go out and then you possibly, you get called back because it isn't anything going on, but you get dispatched by 911,
Yeah.
is that considered a call? If you're going out and it gets reported and they cancel the call?
It's still, if we get canceled, it goes under good intent, 471 times.
Okay.
Is there an explanation or rationale of why you cite that we have the highest percentage or number of structure fires in the state of New Hampshire?
One
Do you
easy,
know why that is?
one easy explanation is that we don't have a true population. I have argued adamantly since the day I started here that our population is not 16,000.
Well, it's not. I agree.
In my opinion, it's not. It's much higher, it's probably closer to 28. But even if you divided our fires by the 28, we still have an extremely high fire ratio. Why? The bulk of our residents that claim this city to be their home live in apartments. The bulk of the apartments are absentee landlords. There's no ownership to the building, there's no care for the buildings are literally treated like dumps. That drives fires through the roof. Fire alarm systems are neglected, properties are neglected. Then you have the tenants that tend to have no care for the property as well. So all that increases the workload. Then you have the density of the building. Like I said, you could have an old three-story apartment house, an old three-story house that was a single-family home when it was built. It's now a 3, 4, and 5-unit apartment house. So you've taken a building made for 3 or 4 people of one family, and you've put 20 to 25 people in them. So all that drives the fire threat through the roof, compounded with the fact that a significant portion of the city's buildings are old. They were built prior to 1960. Because if you note, where are the fires? Very seldom do you see a fire in Long Bay or Southdown. We have them there, but very, very seldom do you see them there. Very seldom, we go to Briarcrest frequently for fires, but you don't see a lot of fires considering how many people are there. Again, the fires are in the downtown core area. They're in Lakeport because that's where the properties are older, but in the downtown core area, that's where we have the lion's share of our multifamily dwellings. Oh, okay for him to go back? So I can get back on track? Where was I? So, all right, yeah, so we're looking at an $80,000 savings in overtime, and until we get through this month, that could be higher, it could be lower, depending on how the rest of the month takes us. And comparing us to other cities and towns, looking at 19 communities, we have the lowest cost per home, we have the second lowest cost per call. We're the 8th busiest in total emergency calls. We have the second highest rate of calls per 1,000 residents. We have the second highest rate of calls per firefighter on duty, and we still are the first in structure fires per 1,000 residents. MRI in their study pointed out the fact that our budget, yes, is higher, but proportionally our workload is much greater. But what do we provide the city? Laconia Fire Department and Police Department, we help provide a stable business environment and a stable economy. There's no question that if you move into the city of Laconia, you're much better served by public safety. As I stated earlier, our insurance rate is one of the lowest in the state. That's something that we should be marketing as however we market our city. Class 3 fire insurance rate, your insurance is as compared to any city or town from Concord north is going to be substantially lower from an operating perspective. If you're moving into the industrial park, you're going to pay a lot less for property insurance than you would if you were going to move in the same industrial park, Guilford, Meredith, Belmont, Franklin, Tilton. Substantially less, 20 to 25% or higher depending on what type of building you build. That's something that we need to be pushing as a marketing tool to even push more growth in the community. 86%, right now, 86% of all of our structure fires are quickly controlled. That's because of the staffing, the recalls, and the automatic aid. We're doing a very good job of getting in there quickly and containing our fires. Someone actually said to me, geez, Chief, you haven't had fires in ages. That's not true. We have them all the time. They don't make the front page of the news because we do such a good job of putting them out. As an example, 2-3 weeks ago, we had a fire on Shore Drive that had the potential to be severe. It still did significant damage to this cellar, but we put that fire out. Literally, it was out by the time I left the manager's office and got to the fire, and that's because of the fast response we have and we're putting good crews in there. Our EMS is second to none, and that's something we need to, I think, push. The opportunity, I mean, we have a 24% cardiac arrest survival rate right now in the city, looking out over the last 4 or 5 years. As of this week, it's 100%. That's absolutely phenomenal that our people are that good at getting to the call with enough people to save that many lives. And the residents in the city have said, they've said it several times in the last couple of years, that public safety is important to them. They want to see the community become safer, and good public safety drives that. I know the girl from Pumpkin Festival said one of the key things that she liked about Laconia was the willingness of public safety to work with her. And I think we work on both sides of the department, we work well with everybody. But this is what it's all about. These gentlemen were in front of you earlier this year. They saved 2 people's lives this past winter. Last year, for the calendar year, they saved 25 lives. 25 lives of people that were status 1 patients are alive and walking around the city of Laconia. This is just a spreadsheet of our call volume by time frame, and you can see on the bottom is the time frame, and at 7 a.m. it starts to peak. It pretty much peaks out at 9 a.m., stays pretty standard across the board until about 9 p.m., and then it starts dropping off at night. This is an amazing slide. This is our call volume by day a week. The change is, you would think it would change dramatically on weekends. It doesn't. It doesn't change at all. The low is 14%, the high is 15%. Last Monday, between 9 a.m. and 9:30, we had 7 emergency calls in a half hour. I have no reason why, but it is amazing how we can go through a quiet weekend and come in and get in here on Monday morning and the calls go through the roof. But statistically, there is no day in the city of Laconia that is any quieter than in any other day. So when I sit there and try to decide how to do my staffing, you can see that there really aren't a lot of options. I always like to bring up the fact that we had perfect attendance for everybody on this sheet has perfect attendance last year. However, Chris Bowden is 9 consecutive years in a row. Heidi Boldak is on her 3rd year. Dan Doucette is on his 3rd year. Dennis Camo is on his 2nd year. And Chuck Campbell's on his 2nd year. Lieutenant Ellingson, Lieutenant Valancourt, Deb Black, Steve Hansa, Trevor Green, Kyle Joseph, Scott Lewandowski, Don Pickowitz, and Ray Bushy also had perfect attendance to work last year. And then we had 6 others that used no more than 2 days. So people like to come to work to Laconia. For the work they do, it's amazing we don't have more injuries. Well, actually, this would be illnesses, not injuries.
That means Chris hasn't missed a shift in 9 years?
In 9 years. We're actually running out of people as I stand here. This is the 4th call since I've stood here. I don't make this up, Scott, you know that. Actually, because it's bike week, we actually have a couple extra people on the way, so that'll make it more manageable. This is what we do all the time. Some of these fires you might recognize. This is training. This is all within the last year. This is something I think is, this prop on the right is they built this on the garage at the station. It's going to get moved into the new station, but it's a training prop teaching firefighters how to self-evacuate out of a burning room called a bailout drill. Here we are training on cutting a hole in a roof on a building that was going to get torn down. So I think we kind of talked about the year in review already. That's not mine. Sorry, Mary. I'm all done with the slides. Sorry about that. You should have told me that was coming up. It was a great picture, Mary. So budget-wise, I did want to talk about just the immediate needs that's in your book that I gave you. Want to retain the 4 safer positions, complete the station project, which is moving along nicely. On the capital budget, I have a request in to replace portable radios. And real quickly to talk about that, we're having an issue getting to the Mutual Aid Center, and a lot of it just has to do with the buildup of the city. Some of the buildings are so big, it's difficult to transmit out of, so we're looking at new portable radios that allow us to add 2 watts of power. But when you think that the radios only have 4.5 watts, 2 more watts of power is significant, and Chief Biotti is actually running tests on all these radios to see which brand is going to work best for us. We did have a request in for an inflatable rescue boat. Obviously, next year, we want to retain the 4 firefighters, looking to put 4 more firefighters on in accordance with the MRI report. We want to bring our student interns back. Once we get the new station completed, we're going to bring our student interns back to the first year and then to the second year. You don't want 4 students at the same time. And that would, in essence, reinstitute the call program using students. And then next year, we want to replace engine 3. And then long-term, that's a long ways away. So the operating budget itself, we're looking at,
Chief,
yes,
could I just interrupt you on the first part there?
Yes.
The radios, you got in for 44 radios?
was it 44?
Yeah.
Yeah, it's right around 40, yeah, depending on the cost of what radios, yes.
Why do you need so many?
We literally assign 1 to every person. And then we have a couple of spares.
You even do the ones that are over 20 miles away?
Say that again?
You assign 1 to the ones that are 20 miles away?
Everybody has a portable, yes. From a safety perspective, Counselor, and a maintenance perspective, it's their portable. They take ownership of it. They take much better care of it. You don't worry about coming in and when was the portable battery changed? Was the microphone tested? Is it on the right frequency? But with the significant number of we actually have a significant number of firefighters now that live within either in the city or within close proximity. And I think it's actually up to 20. So they take their portable home with them, and they respond to emergencies on or off duty. They have direct communications with Mutual Aid Center. They can get to an emergency and call us on the radio and say, this is what you got. So, yeah, having their own portable, I think, is instrumental to the safety of the firefighters.
If those were changed in a 2-year period, would that be acceptable? In other words, do half this year, half next year?
The only thing I worry about is, do you end up with the same radio 2 years from now? Radios are changing dramatically, and it's kind of like your phone. If we bought 22 today and said, let's get 22 tomorrow, they're going to be a completely different radio. It may be something as simple as the battery's not interchangeable anymore. We actually have that issue right now where anything we get, the batteries from the old radios won't work with the new radios. So now you're talking, you may have to get different chargers. I guess we could do it, but that means we're going to have 10-year-old portables, brand-new portables, and again, it's an operational issue where if we're out of the scene and your battery dies and, now we got to go make sure we got your spare battery that mixes your radio versus the spare battery for someone else's radio. It sounds simple, but if you're crawling around and burn a building and you keep a spare battery in your pocket and you pull it out and hand it to the guy behind you and it's not going to work, I think it's better to get them all at once. I really do. We don't replace bunker. I try to replace a lot of items on a rotating basis. These, as an example, we try to buy 5 or 6 a year and just keep rotating the stock. Bunker gear, every year we try to do about 6 to 7 sets of bunker gear, so we're not coming in front of you trying to buy 40 sets of bunker gear all at once. But I think on radios, just from an operational and safety perspective, I think it's best
Is
to
that
get...
the radios you're talking about?
No, this is a pager. This notifies everybody of calls. The portables I'm talking about are the portable radio, shoulder mic, carrying case. Motorola is the most specific that everybody knows of, but it could be a Kenwood, it could be an ICOM. We're looking at the different ones out there to see what's going to work for us.
Did I hear you earlier say that, I don't want to put words in your mouth, so maybe you can say it again. You mentioned $80,000. We saved $80,000.
On the overtime budget in the current fiscal year, I'm projecting that we're going to turn back $80,000.
Okay, so I'm understanding that then to mean $80,000 that was budgeted for
Yes.
overtime will not be spent.
That's correct.
Okay. Can you walk us through where that shows up in the budget?
It's pretty much an overtime.
Well,
I
okay,
didn't-
so
I'm sorry, I
overtime,
didn't-
I'm assuming it means, in this case, extra duty coverage? That's
Well,
overtime?
it's extra duty, personal coverage, sick and injury, and vacation personal. The bulk of it is in those lines. I think you'll find that some of it came out of regular salaries as well. Some of the, because we probably had some vacancies that didn't so there was money saved in regular salaries as well, but the bulk of the 80,000 is going to come out of personal, extra duty, sick and injury, and vacation. I'm sorry, I
So it's
didn't,
not just overtime then, or?
well, that's all
That's
the
where it gets
categories of
billed,
overtime.
okay.
I prefer a one-line item called overtime, but it's always been this way, that
Would be nice.
I didn't make this budget. This was always designed, and I find this very confusing, just
Yeah,
like
we
I
do
have
too.
like 5
Okay,
different...
so last year, we budgeted whatever those numbers add up to, okay?
Correct.
So what you're saying is that in those line items added up, whatever that number is from the budget, when we get a final report for actual for 2014-15, the number is going to be $80,000 less?
Yes.
Okay,
It may not, I mean, it might not add up 100% in there, because some of it's going to come out of retirement, because when you spend less money, you spend less retirement. So it's a little bit of regular salaries, a lot of it's overtime, and there'll be some of it out of retirement. Donna, any others?
Well, part of it was the rate, too.
The rate went down with new hires versus old hires, but the bottom line, though, is we're turning back $80,000. And that's, the savings is through, we ran short on occasion, which I said I would. We haven't been running short lately because the work's through the roof. Lack of recalls is a significant amount of the money. Injuries is down roughly $100,000, and that's between the hospital and the fire department. And then the fires that we have had have been, we've had significant number of fires, but they haven't been long-term fires. So most of our fires have been pretty much 1 hour to 2 hour instead of, we had several fires last year that were 13 hours, 10 hours, 11 hours. Obviously, those drove the numbers through the
so
roof.
if here, just trying to understand this, working through it, if here is our personnel budget for 14-15, and here is the actual, which is $80,000 less, where are we budgeting, adding all those numbers up for fiscal 16?
We're budgeting, fiscal 16 will pretty much be the same amount of overtime, up to that same number that we're at previous year. And then there's the additional funding to cover the 4 SAPR firefighters from October to July.
All right, so then this goes to here.
Well, the budget's gone from $3,800,000.
Talking about personnel costs now. If this was the actual from last year, or this was the budget, and this is how much we spent here, okay? So the new budget is back up here, plus full funding for the year.
Yes.
For the safer,
Yes.
the 4 safer firefighters. Okay, so I guess my question is, if this was the budget for last year and the actual was here, not counting the safer firefighters, why didn't we budget overtime for here? The actual for this year as opposed to the budget for last year?
Well, we budgeted what I felt was needed with the idea that we would try to run shifts down. Instead of running 9 on duty 24/7, we would run down with the idea that we would take leftover money, turn it back to put it into the reserve fund to help offset the cost of the safer firefighters. So you can cut that down, but don't ask me to give any money back. And
You're
we,
increasing it to get money back.
No, if you look at the numbers, actually, Counselor, and to the mayor's point, if you look at the 14-15 budgeted number, and let's start with the first 3 line items, personnel, extra duty, and sick and injury. So the first number under 14-15 is $36,040. That's only inflated by the cost of any COLAs or steps that somebody got. So if you look at it, it's $36,000, it's still $36,000 in what's budgeted this year. The next line item, which is extra duty coverage, $67,800 to $69,200. It's up about $1,400, again, just related to wages in this year's budget versus wages in last year's budget. There's really not any bumping up other than just a COLA to it. The next item down is sick and injury, $68,009 to $70,200. Again, it's $1,500.
Yeah.
Yeah.
Right? So there's no bump up in overtime in order to provide the savings. It strictly reflects
No,
what the wage
that's not what
scale is
I'm,
now.
that's not what I'm saying. What I'm saying is, what I'm questioning is, if we know from actual experience the last 2 years that we've come in $70,000 and $80,000 under on personnel budget, why don't we budget next year accordingly?
what I've been,
Plus the part of the year that we'll have to pay for the
what I
4 firefighters that were paid for by the grants.
What I have historically done is presented an average overtime budget. based on fires, everything we do over a 5-year average is what I use. Put those numbers together, multiply it times the average overtime rate, and say, this is what I think I need. This is kind of like budgeting for snow. You know, we can have a great winter and not have a lot of plowing. I don't know, I know my averages, but one injury, a guy's out for 6 months, throws the averages out. A fire like Skate Escape that was 12 hours long, or a fire like Davis Place that was 14 hours long, that one fire is probably the equivalent of 10 smaller fires. The overtime budget can just change dramatically on a very simple level. The time off factor, the vacation time, the sick time, the personal days, that's fairly stable. The less sick time they use, though, the more personal time they get. So there's a double-edged sword there, but that's, you know, that's in the contract with all city employees. But the injury, we're watching it go down. We hope it stays down. I could have 5 guys get injured tonight at a building fire, you know, and I'm going to have one shift that's cut in half, just like that. So that's why we budget this way. Instead of coming back to you halfway through the year saying, I need to close the weirs, or I need to stop putting the ladder truck out of service, we try to put in enough money. But it was always kind of agreed upon in the last 2 years that we would try to run short as much as I could, and we've been able to do that, and then turn the money back to put it into that reserve fund to help pay for the 4 firefighters. I think as time goes on, if we see that this trend is going to continue, with the 9, if we maintain the 9 people on duty, this will go down.
Well, I think philosophically, the question, and I understand your logic, I think the question philosophically is, do we tax people and collect the money up front with the understanding that some of it gets turned back if we don't spend it, or do we just not tax them in the first place and take our chances of having to do a supplemental appropriation or whatever whatever the case may be? I realize it's not an exact science, but you seem to be building a track record that says you're gonna run under by some amount every year. Certainly 50 would be relatively conservative based on recent track.
Some of the track record, I think, is just the fact that, again, injuries drop dramatically, recalls have dropped down, but at the same time, our calls are going through the roof. You know, I don't foresee, I mean, if we keep going at 16%, we're putting multiple vehicles on the road all the time. So to try and start running down to 8 more often is getting less and less likely. It's either that or I go down to 8 and start putting recalls out. There's the double-edged sword. I figured it out. If we had been running down to 8 in May, I would have put 30 recalls in at a rough cost of $8,100. So you try to maintain staffing. I tell you what I think I need, and then I try to maintain that 100% of the time. That's how we've been doing it. We've been fortunate in the last 2 years to save some money.
I see a hand up over here.
Yeah.
Councilor Whitman.
I mean, I think on the issue of taxing and collecting and putting it back, the reality is each year we take a certain amount out of fund balance to carry forward to reduce the tax rate. So if there is an effect like that, it's really only a one-time kind of thing, and because we're pulling in that amount. But I mean, I think the issue of attributing it to sort of like snow is somewhat valid, kind of a way to look at it. And on the other hand, I think that, if we end up pulling too much through, then, it's not like we're losing it or that we're driving up the tax rate in proportion. We've been taking a little bit more out of fund balance each year. I don't see that as a big part of the debate here. I think the bigger part of the debate is, whether, as a city we want to have 8 or 9 people on and what that amounts to, and probably that's a better place for us to spend our time.
Handouts that I think the council's seen before, but I'll pass them around again, that discussed the 4 firefighters that we started basically probably just a little bit over 2 years ago with the SAFER grant. So I think they started the last week in May of 2013.
Yes.
So I'll wait till everybody gets a copy of the sheet. Probably be a couple extras left if anybody wants to grab one. So we've broken down how to make this a long-term, sustainable solution in order to the staffing of 9 firefighters. Remember, prior to the SAFER grant, we were at 8, and the MRI report, which most of you were on the council when we funded that, shows we should actually be at 10, if not more, based on our workload. So I'm going to start in where it says fiscal year 2016, which is the budget we're working on right now. And we've got 52 weeks that we have to provide funding for the 4 firefighters if we're going to maintain that staffing level. So how do we do that? We, meaning the city and the fire department, reached out to the folks at FEMA who provided us the SAFER grant, the federal government, and because we had some funds left that came in less than we didn't utilize all the funds we had applied for. When we put the grant in, we based it on 4 firefighters with a salary, with an average amount of overtime, with a blended, health insurance plan based on our statistics, and we put together a number they approved for fully funding salary, benefits, including retirement system costs, health insurance costs. They put that number together, and based on how the numbers bore out, wages starting, health insurance plans selected, we didn't run that money out at the end of May 2015 like we had anticipated. We reached out to FEMA and asked, rather than turning that money back in, to have it reprogrammed. It was a relatively small amount in FEMA's world. They agreed to allow the city to extend that grant until the dollars are gone. So based on who we have working for us, that's going to cover 13 weeks of coverage. So you can see that as the second bullet point under fiscal year 2016. So from July 1 until the end of September, the remaining money in the FEMA grant, one-time money, when it's gone after this year it's gone, will cover 13 weeks. We also have 5 weeks, the bullet point right below it, we have 5 weeks in the budget year we're going to close out in a couple more weeks, because when we put the budget together last year, the anticipation was that we needed to fund 5 weeks out of the general fund once the grant expired. So those 5 weeks, the request will come because we're not going to need the money this fiscal year to capture the value of that money, in essence, and carry it forward to next year. So that'll fund an additional 5 weeks of the firefighters. In discussions with the hospital, because we have 9 firefighters on a shift right now, the hospital has not been needing to pay for what they call an extra paramedic position, which they run basically Monday through Saturday, and I believe the hours are from 7 a.m. to 6 p.m., our high time for ambulance calls. The value to the hospital, and there's certainly a value to the city, but the value to the hospital is we, City of Laconia Ambulance, are transporting more patients, not having the need to call in for a neighboring community for the ambulance, and therefore our hospital, who's a great partner with us, is able to bill for those calls. They see the value in having that 9th person on, and had been paying for that prior to us getting the SAFER grant. Now, if we maintain at 9, the hospital wants to support us in maintaining at 9. They're willing to reallocate part of that expense they were paying for that Monday to Saturday 9th person coverage towards keeping the 4 firefighters on, and by having 4, it allows all 4 of our shifts, regardless of the day of the week, and you saw the chief's chart on that, to operate with 9 firefighters. So in essence, the value is shifting from the hospital paying for a purely dedicated paramedic coverage, even though that person would do perform other duties as well. The hospital is willing to shift those funds, and the value of that is $127,000. That equates to the value of an additional 26 weeks, or a half a year, of the 4 firefighters. You put those 3 numbers together, 26 weeks, 13 weeks, and 5 weeks, we have, for the next fiscal year, 44 weeks out of 52 covered, either with existing dollars from extending the grant, existing dollars that are in this budget, or contribution on the part of the hospital. So what is new money in this year's budget, the proposed budget you're working on, is basically the other 8 weeks, and that equates to $50,000. And that doesn't talk about us tapping into any of the money that went into the reserve account last year that the chief returned, and the council set up the fire stabilization account. So I believe there's $70,000 in that account right now, so we did not even look to touch that money this year. The chief has indicated there'd be another $80,000 that if the council chose could roll over into the budget at the end of this fiscal year. We're not talking about using any of that money for the scenario. $50,000 of new money is in the budget in front of you if you choose to leave it there. that funds for firefighters with everything else. Fiscal year 17, I'll go through it a little quicker, but kind of the same process. There's 52 weeks in the year. Again, with a hospital contract would cover 26 weeks of it. With the $50,000 of new money going in this year's budget, in essence, that's already built into the following year budget. So that's 8 weeks. We need 34 weeks, so that takes us to 34 weeks in the budget for fiscal year 17. We need to fund 18 weeks out of other sources. We would be looking to use $60,000 out of the savings that'll be there as of June 30th, $150,000 in the account that we haven't touched yet. And I would be looking to add $45,000 in new money to next year's budget. Same scenario with the following year, 26 weeks of coverage from the hospital. We've already now built 19 weeks into that budget, and if we funded additional $45,000 the third year, that gets all 4 firefighters rotated into the budget incrementally, where the total impact is $50,000 this year, $45,000 in new money next year, and $45,000 in new money the following year. And that really only talks about using, the transfer money 2 times, and then there's no reliance on money flowing in. If it's not there, then at that point, if we want to start looking at a couple years of track record and seeing where overtime is and backing it out, we've got a lot of options available, but this is a very conservative approach. It's real money that will be in the bank as of June 30th. It's not counting on any new money rolling into that stabilization account in any more years than what we know will be there on this June 30th. And the greatest impact is this year's budget of $50,000, and it fits within the total parameter of the budget that I presented to you, which is a 1.6% increase in the amount raised by taxes, which complies with our tax cap. So happy to answer any questions.
The base assumption here is that 4 firefighters, total bottom line cost, salaries, benefits, retirement is $254,000 a year.
And we've based that based on the last 2
And that's not going to
years'
change over 3
statistics.
years.
No, we've actually inflated, because the hospitals agreed to pay the half the salary of the 2 most junior firefighters. So the hospital's number will be not necessarily incrementing as that person moves up the steps, but we're discussing just putting in whatever the CPI inflator is to it, so that would be made whole. But the other numbers have factored in a salary increase for year 2 and year 3. So we've looked at an assumed rate for a COLA and a step, and an assumed rate for any change in health insurance. We know retirement system costs start this July 1, are
So
stable
the
for the next
LRGH
2
cost
years.
stays the same, but our cost is inflated.
Right, the LRGH, the discussions, and we haven't finalized the agreement. When we do, it'll come to you. We're having discussions about a small CPI inflator just to keep pace with the wages component of it, so that it's not a flat number. It'll keep pace with the wages. But the agreement is they would pay the salary equate to the 4 most junior firefighters as opposed to the most senior firefighters, which they graciously do on on the ambulance. They pay the salary and benefits of the 4 highest paid paramedics in the city. It's a nice combination. It's really been a great partnership, which is a model for a lot of communities across the state. We truly appreciate everything Lake Street Region General Hospital does, and I know the chief echoes that all the time in conversations when he's making presentations to groups around the city. It is a win-win. They provide state-of-the-art ambulances and rotate those through on a regular basis, so we've always got first rate. When we had some injuries due to a significant amount of bariatric patients, they stepped up and helped us and got a motorized lift, so there was less wear and tear. We still have challenges sometimes with our crews getting people out of some of the older apartment buildings and down narrow stairs. Is not a good way to get 4 or 6 people, around and try to navigate a staircase, but having the 9, part of the reason we believe the injuries are down now is because we basically threatened some of the staff, to put it in a nice way, that, we're not going to get silly injuries anymore. We've got people, if you need an assistance with a transport or a lift, part of having 9 allows us a little bit of flexibility to respond to that. So I think a number of things have gone in to reduce the injuries. As the chief said, there's no crystal ball. Next year, we could just have a run of bad luck. But I feel if we do this approach, it is a minimal impact to the budget. When you look at the overall budget, it's within the tax cap. The extra level of protection we get by having the 9 is really beneficial on a number of fronts, including the training, the inspections that we're doing, the on-duty inspections that are happening that are not going to happen with 8. There's a number of intangibles out there that really don't fully reflect here. We are a very busy department. I mean, I know the chief is here, and he lives, eats, and breathes this, but we are a very, very busy department, and the medical calls are a huge component of that.
Questions from the council? Councilor Bear.
Speaking of medical, a lot of it is the drug overdoses, correct? I believe we had 4 this weekend.
Yes.
And so my question was about the Narcan. Do you pay for that? Is it grant money or?
Lakes Region General Hospital pays for everything in those ambulances. They in turn bill the patient.
Because I understand Narcan is doubling in price.
There's actually a shortage of Narcan in the system, yeah.
Do we use injection or EpiPen?
It's really the call of the paramedic on duty. I watched one
'Cause one
Saturday
is
afternoon.
much more
It went-
expensive
They did
than
it
the other.
nasally.
Yeah.
It was a respiratory arrest, 25-year-old male. They injected it nasally. They had to infuse it nasally, inject it would be.
EpiPen?
But they had to do it 3 times to get him to revive. A lot of times they do it IVs. It's really the call of the paramedic and based a lot on the patient and how the patient presents itself.
Carry all,
Yes, we're
different-
probably the best equipped ambulance service, truly in my opinion, in the state of New Hampshire. And we're probably the best trained in the state of New Hampshire. And it's all because of the partnership we have with the hospital. There's no question about it. But the actual cost for the drugs is all borne by the hospital. They in turn then bill the patient and hope to recover it. But I can tell you that based on the patients, most of these patients are not paying the bill.
right?
So the hospital in turn loses that money.
One of the, just aside, one of the overdoses he was telling me about was somebody that has been saved 10 times by Narcan, which means they rely on the fact that there is Narcan available so they can go out.
I don't know 10 times, but we have saved the same people several times.
Yeah.
But I will also say that we do the same thing for elderly people that call 911, whether they're having a stroke or a medical condition. You know, we don't say, oh, we've been to you 3 times, you're
Oh,
done.
no, I
But-
didn't mean it that way.
Okay,
I just said
well,
that
there's actually a debate out there, you know, when do you stop?
Don't go there.
Yeah, we'll stop that conversation right now, yeah, I can get in trouble for that. But we do save the same people several times, but it's the same, we go to a lot of elderly people the same time over again as well.
Do you have any idea of the cost of the?
Offhand, Counselor, I don't know. I'd have to,
Because it comes with the ambulance.
no, if Deputy Riley
I
was,
think per dose, it's like $75 or something like that. I mean, it's
It
not,
depends on which method.
if Deputy Riley was here, he could tell you exactly. He's actually on duty tonight because of Bike Week, but he could tell you exactly the cost of the Narcan. He could tell you whether it was a needle or a nasal, the different prices. It's not cheap.
No, one is more expensive
But,
than the
you know, we've saved several people that have then, in turn, gone into the system with Officer Adams, and 2 of them that I'm aware of have been recovered. So, you know, there is hope. And you do this time and time again, you talk to these people, you know, you say, you were dead, you're now alive. Take advantage of this opportunity and fix yourself, and then Officer Adams and Deputy Riley will actually work in conjunction, along with a lot of other people, to try and make these people see the good in life and get off this drug. And it's not just heroin either, there's a lot of other issues out there. Oxycodone's still a major problem, but right now heroin is by far the worst.
other questions? Councilor Hammond.
On your explanation, Scott, like in 2018, it says 9 weeks of coverage already built in. So as the years go on, you're saying, what he's saying, that we're picking up the weeks as a normal budget increase?
It's built into the budget.
Yes, and rather than hitting all at one time, it's being hit in baby steps, if you will. So we're fortunate to have the grant for this cycle, and we don't need to use as much out of the general fund budget. So the 13 weeks is one-time money that goes away, but we've got 5 weeks built into the budget that we're going to close the year out on, and by getting 8 more weeks in the budget you're working on, That builds us towards 13 weeks, and the hospital's committing to what equals 26 weeks. So we're at 39, the grant goes away, how do we make it a smaller hit on the budget, if you will, so that whole 13 weeks doesn't hit? Well, part of it we're going to put into the budget for $45,000, and part of it we'll take out of that one-time money for $60,000. You can see in fiscal year 17, the $60,000, which we know is already sitting in the savings account, if you will, is going to cover 11 weeks of it. So now we need to fund $45,000. So we're getting in the full value of them in 3 increments, but no increment is larger than $50,000.
So,
Okay,
go ahead.
all right, to have a follow-up? Follow-up?
Yep, go ahead.
Okay. When I kind of look at this, I kind of look at it like, I'm looking at it as a 3-legged stool, I guess you could say. We have the monies from the hospital, which probably will be steady all those years, the years coming. Then we have the other 2, which are monies that come back from the fire department.
Part of it's the grant that's going to run out this
Yeah,
year.
but that's
and
going
part of it
to
is-
run
yeah,
out.
yeah.
And then the other one is the safer, not the safer grant, but the stabilization money.
Correct.
So those are kind of built on, maybe we'll have it, maybe we won't.
No, if you look at the scenario again, $70,000 is already sitting there today.
Yeah, I understand that part,
All right,
but I'm
80
saying future.
Nope, the $80,000 we've committed to have on June 30th, that's the only 2 times we need to count on that money. If not another dime showed up into there, this is the impact, $50,000, $45,000, $45,000, and then it's there. Think of it this way, let's say we were to bump winter maintenance from $400,000 to $500,000, and we do it in 1 year, the delta that we're feeling is $100,000. It's all going to go in 1 year. But the following year, once we're already at $500,000 and we continue to fund at $500,000, there's no new impact to the budget that year. So what I'm showing you is only counting on the money that we know is going to be there, only counting on the SAFER grant, and not counting on any additional money afterwards, we're going to get to the level we need in $50,000 this year, $45,000 in new budgeted money next year, and $45,000 the following year. Then they're built in, salaries, benefits, then it's just normal inflation after that point.
It's built in, but you're still, in the long run, you're adding, the first year, roughly $254,000.
But the impact to what's showing up in someone's property tax bill is $50,000. Because the funding is coming from the hospital, the funding is coming from the SAFER grant, the funding is coming from money that's already in this year's budget that we're going to ask you to carry forward because we're extending the grant.
Yeah, I understand, yes, but eventually, that money is going to hit the taxpayers.
Not the whole 250, it's already built in. If we follow this program of 50,000, 45, and 45, if you're thinking in year 4, there's 250,000, the answer is no. At the end of the day, other than general wage inflation or health insurance inflation, there's no new hit. It's built in.
So, I'm sorry to be dense here, but explain to me one more time the 8, 8, and 19.
So in fiscal year,
8 weeks of coverage left to cover from the 2015 budget, or
all right, so if there's 52 weeks in the year, and we're saying for this coming budget, 26 weeks, is the 127,000 from the hospital will cover 26 weeks.
I understand that. I'm
Okay.
just asking about the
So-
3 line items that say coverage left.
Yep, so that's the dollar amount that we need to provide the coverage for those 4 firefighters in the remaining 8 weeks of the budget that isn't funded by another source. So it's,
Sorry, let's skip down to fiscal year 2017.
okay.
What do you mean by 8 weeks of coverage included in the 16 budget?
We will have funded
50
8
grand.
weeks already in the budget we're going to adopt this year. So there's already 8 weeks' worth of salary built into the following year's budget if it's adopted this year.
It's the analogous to the snow.
So we're over budgeting the year before?
Nope.
No, so let me get it. Let me just get it if I understand it. What you've got in the firefighter stabilization balance right now is $70,000 there, plus or minus.
Correct.
Right? You're looking at a return from this fiscal year of $81,000 or whatever the projection is right now. You're going to take that money and you're going to use it over the next fiscal year 16, well, not in 16, but in 17 and 18, you're going to take that account and basically use it to fund the 4 firefighters throughout the 3 fiscal years. And you're using the carryover from last fiscal year to get you to the $50,000 added to the fiscal year 16.
Correct.
Got that right?
Exactly.
Okay. So in essence,
Go ahead.
okay. So in essence, what you're really asking us to do, and I'm not saying this is not a good idea or a bad idea, I'm not taking a position. What you're asking us to do is to take money from the budget, anticipate the future costs, and keep it in the budget throughout the 3 years. So it actually is, it actually is a taxable event to the taxpayers. You're saying it's $50,000, it's $45,000, and $45,000.
Right.
But theoretically, we could take all this money and reduce everything and give everybody a better tax rate, right?
You could, except I think at that
that
point,
would be- it might be
we're shaving the overtime budget dangerously low.
I'm not
Yes.
commenting
But
on the
but I guess
wisdom
my
of it.
question is, are you assuming in the fiscal year 2017, where you say 18 weeks of coverage left over from 17, are you assuming in making that statement a savings in overtime in the 2016 budget?
No, it's money that's already built into the budget that we've put into the budget coming this year. It's the new $50,000 that's already in the budget that we're putting in this year.
Or another way of maybe asking the question is, if we were able to return it back, we wouldn't necessarily have to fund the 45,000 in 17.
Correct. If next year's budget ends and we're doing this scenario, and we said the chief's getting ready to turn in $45,000, and I'm not counting on it, but were he to do that, we could say we can reduce 45,000, let the money roll in as a carry forward, and immediately reallocate it for the next year. So this is a very conservative approach where it's not projecting that we need to have these $70,000 and $80,000 savings rolling in every year. I'm not counting on anything after this June 30th, and the numbers are this conservative. So what Councilor Lippman says, if next June we say to you, yeah, we're going to put $50,000 in, I will say to you, having presented the budget in March, okay, I'm comfortable with you reducing the fire department by $45,000 because the money's going to roll into that.
I think the converse concern would be if this plan was okay. The other concern is if the experience we've had that have resulted in having a stabilization fund, if perchance the system was gamed, if you will, to recover overtime use, then, you know, if overtime didn't go down, if overtime went up in some significant way, then, you know, we would potentially have exposure to, you know, increased costs over what's here.
Absolutely. I mean, if there was something unique that happened like that, then absolutely.
But you have some cushion built into this from the standpoint that you're only looking to draw down 90 of the 150.
We're looking to draw down, 60 and then 95. So we're looking to draw down what's there over 2 years.
60, okay, 60, I'm just looking at the wrong number.
Yeah.
Yep, 60 and 95, okay.
But again, it's not counting on any additional money, and again, if we have a couple-year track record of overtime coming in below, then, as Councilor Lippman pointed out, you may decide a year from now, well, we're going to transfer some money in so we can back some money out of the current year budget, because we'll do that transfer and not carry anything, just have it be more of a pass-through. And there's no stipulation. I mean, at any time going forward, as the council knows, they can choose to cut staffing levels. There is no requirement from grants. The grant is expiring. There's no requirement on this grant that you maintain staffing levels. But council maintains that full control, full authority at any point out. This was just one scenario on someone says to me, okay, well, that's great. You can do it for 1 year because the SAFER grant extends to October 1st. But how about the next year? So I really wanted to show you a 3-year scenario of what the true impact is. And from my position and chief's position and staff position, It's very manageable, and it works within this year's budget of 1.6%.
Other questions? Okay, thank you, Chief.
Wait.
Oops, I'm sorry, Counselor Hamel.
Sorry, Chief.
No problem.
What would, say, we looked at a plan of integrating the 4 men over a period of time instead of all at once. How would that be acceptable? How would that work? In other words, at the at the police station, we've hired 2 officers now, but we did it over a period of time, funded, half their salary in one budget, half in another.
In
Kept them
essence,
on, so.
you're saying we're going to lay off people we've just spent the last couple of years training. From that perspective alone, would be an absolute waste of our time and resources. We need these people all the time. I've been emphatic about, we need 12 on duty. I actually think we're getting to the point where we need 13 on duty. MRI, in their study, says we need 11 on duty. We are not a little town like people think we are. We're a very, very busy fire department. We have huge problems that we face. I think the package I gave you I think I did a pretty good job of explaining it to you. 9 on duty, in my opinion, is not enough. I'm going to probably ask for 4 more next year on top of
But
this.
what is enough?
In my opinion, right now, 12.
So 3 more guys.
4 in the weirs.
12 more guys.
4 in the weirs, 8 downtown, 24 hours a day, 365 days a year. There'd be 3 on the engine, 3 on a ladder truck, 2 on an ambulance, 2 on the engine, 2 on a ladder truck, and they'd cross-staff the ambulance. In my opinion, that's what we need in the city of Laconia. I didn't build the city. I didn't create the problems. It's my job to try and protect it as best as possible. My job to tell you what I think we need to do it. You decide, the priorities, but I think 9 is really the bare minimum.
I read through your book you gave us, and
Yes.
I thank you for that.
You're very welcome.
And there was a section there that was kind of interesting to me. It was called Laconia is a Unique City.
Yes.
After I read that, I'm debating whether I want to live in Laconia. I think everybody should move out of Laconia.
I'm just telling you.
It's basically, and I read this, and it's a tear down. In my job, previous job, I was fortunate that I'd been in about every city and town there is in New Hampshire. And I don't think Laconia is that unique from most places. Concord has multiple high-rises.
Concord also has 21
Pennacook
firefighters on duty.
Pennacook has high-rises. Well, not high-rises, but multiple stories. Franklin, Tilton. There's a number of communities.
Actually,
There's
Franklin
no
and Tilton
different than
don't
us.
have a high-rise in their city.
I'm not saying high-rise, I'm saying multiple apartments, like what you're saying. There's a lot of them everywhere. So Laconia, to me, is no more unique than other places. It's an old city. A lot of New Hampshire cities are old, unless you're in the suburbs. But, this was an old mill town. Nashville's an old mill town. Manchester, all these places. And then they have the same situation as we do. So I just wanted to bring that up, that,
Counselor, first, I just want to tell you that I absolutely love this city. I've given my past 14 years 100% to this city, probably 200%. I didn't mean that in any way, shape, or form to be degrading to the city of Laconia. I was just trying to...
when I read that, it's like, who the hell wants to move here?
I'm just trying to put it from my perspective, from a public safety perspective, what we deal with on a daily basis. And we are a unique city in many, many ways, which makes us special. The rivers and the lakes, Motorcycle Week. But we're also a unique city in the fact that we were an old mill town and we're not anymore, and a lot of those homes have now converted to apartment buildings.
Which, a lot of other places are the same way.
You're going to be hard-pressed to find a city of our size fire department that has the hazards that we have. You've got to probably go to cities of 30,000 people, because most of the cities and towns, Merrimack, Londonderry, Bedford, they don't even come close to the size of the buildings that we have in the city of Laconia. Don't even come close. We have 7-story buildings with no sprinklers in them. We have 6-story buildings with sprinklers just in the hallways. We have 5-story buildings with no sprinklers in them. We have dozens and dozens and probably hundreds of 3- and 4-story wood frame buildings with very, very poor built-in protection, and we're focusing on making them as safe as possible. So this is a unique city from my perspective, and it's my job to tell you what I think. We need to keep it as safe as possible, and I think what I'm asking for is a reasonable request. I really, really do. I don't want to spend any more money than absolutely necessary, but I have a responsibility to tell you what I think is required.
I got another quick question. We have agreements with Guilford, I believe, on a structure fire that they come and
They come automatically, yes.
then we do the same?
Guilford and Belmont both come automatically.
Okay. I guess my question pertains to the ladder truck.
Yeah.
That would respond to Guilford, right? If they have a structure
Probably
fire?
more the Wares ladder truck would go than the downtown ladder truck. It's predominantly the Wares ladder truck goes to Guilford.
Now, in my mind, that's a unique piece of equipment. So I guess my question is, Meredith has a ladder truck, Belmont has a ladder truck, we have a ladder truck, Guilford doesn't have a ladder truck. So as long as we provide them with a ladder truck, they're never going to get one, because we're providing that service to them. And they're probably one of the richest communities around that could afford one. So I guess my question is, on a specialty truck like that, why aren't we charging for that to go? I know it's mutual aid, but still, that's a specialty piece of equipment that the taxpayers of this city spent almost $1 million to buy, and we're...
First of all, it's the Wares ladder truck that goes almost all the time to Guilford. It's not the $1 million ladder truck. Secondly, the ratio that Guilford comes here to help us is probably 3-to-1 from when we go to help them. So if we started billing them to send a ladder truck, and just say we throw out at $500 a piece, they're probably going to say, well, we're going to start billing you to send the engine at 80, 90 times a year. I don't want to cross that path. That's your prerogative. That is not a decision of a fire chief. That is a decision of the political board. I'm a full advocate, and I have been for my entire career, that we should regionalize. It should be one department providing the services, and then the 4 towns pay for that ladder truck, not one town. I've been an advocate of that. You know that.
Yeah,
And
I agree with you.
But again, that's a political decision. It's not a fire chief's decision to go to another town and say, let's regionalize. And politics won't allow it to happen. That's personally my own opinion.
I agree with you there, too.
Because nobody wants to give up control.
Yeah.
Counselor Lippman?
You know, I guess the issue before us is, I think, it's a stretch in balancing all the competing needs to address what you're asking us to address. And I guess what you're probably picking up some sense of is that as soon as we stretch to do that, you're going to ask us to stretch again and again and again. And, you know, I think that from our standpoint, you know, there's risk and judicious risk, okay? And, you know, I think we could staff at 20 firefighters and not eliminate all risks. And so-
That's correct.
So I think that, you know, I think it would help your case to not, you know, push the envelope to eliminate all risk, you know, because I think it's, in terms of trying to balance the competing needs for resources, it just makes it a little uncomfortable as, okay, if we take that step, then the next thing we know, you know, it's a slippery slope from 9 to 12.
Message understood, Counselor.
We do thank you for the candid discussion, though.
Very welcome.
Counselor Mounds?
I just have a quick question, since I'm looking at your projected needs, long-term, short-term, all of that. And I want to know, from just a funding perspective, if you got the 11 that's recommended, the 12 that you think you need to address all the needs, how many additional firefighters, how many are you gonna have in all? I mean, how many do we have right now?
We have 36.
36.
So if we actually,
So
if
if we do 11 or 12 next year, or,
we had 11, we'd have 44, and 12, we'd have 48.
Okay.
For each position you add is like 4 or 5 firefighters.
4, yeah, 4.
okay.
And again, I wouldn't expect you to approve 4 more firefighters next year. I wouldn't. I don't necessarily know if I'm going to ask for it. I was just showing you what I feel, and someday we're probably going to need to build a fire station in North Laconia. That's been on the agenda for years now. The growth up there has been fairly slow. But if that starts to grow up there, that's a long ways away. And, Southdown, Long Bay are long runs for us. People don't, they're like, it's right up the street. It's a long ways up the street. And so at some point, if we start building in more and more in the north end of the city, we're probably going to need to build a fire station up there. Chances are I won't be your fire chief by then, because it just seems to have stopped. But citywide, right now, we're on a building boom. It's amazing, the construction going on in the city of Laconia. And it's funny because some people say, what are you talking about? Get out and drive around, and I'd gladly take all of you and show you. But we have a humongous building boom, and I don't know what the numbers were last year or where we stand right now, but we're seeing it with people walking into the fire station getting building permits on a daily basis.
It was, 29 million last year,
Yes.
fiscal year?
And it was just a couple of years ago, I think we were fortunate to do 10 million in 1 year. So we're in a big building boom right now.
Go ahead.
This is to the manager and Donna. In terms of the funds that we collect from new construction, I'm trying to remember what the...
Impact.
The impact fees.
Thank you. On the impact fees, what dollars would be available to offset any of this?
I think we had those
The fire,
numbers.
There's approximately $14,000 in the impact fees right now for the fire.
That
The total of $48,000.
that could be used to support this funding as well.
It could, we would want to make sure that we use the impact fees either for expanding staffing or for capital needs to it. I want to look at the definition, but there's an opportunity to move money to do that type of thing, but yes.
It's the impact fees right there.
We do the impact fees in the, I think we had them in your agenda packet last week.
Yeah.
And we do that monthly. I think I pointed out that, for all of fiscal year 14, it was fairly slow, and for this year to date, I think we've quadrupled the amount of money that had come in all the prior years, so.
So we got 14,000
More
in,
coming in relatively quickly.
as of 5/31, right? And-
Right.
And some of this stuff is, if you recall, when we implemented impact fees, there were a number of different projects that were grandfathered by way of approval. So as time goes on, the acceleration of the impact fee revenue is another source of financing.
And I think to the chief's point, the amount of development going on in the city right now is going at a rate, and we get the monies coming in upon certificate of occupancy. So the money comes in at the tail end, and you're right, everything, I would assume, the overwhelming majority of stuff from here forward is out of the grandfathered stage, and we would be seeing that revenue stream stay steady and increase as long as the building economy stays solid.
So could you confirm for us what, if any, of that 14,000 or any other funds that come in under that category are actually available to fund this or not?
Yep, we can confirm that.
Other questions? Last chance here. Everybody happy? Okay, Chief, thank you.
Thank you very much,
Keep
everybody.
you so
Appreciate
long.
the opportunity.
Okay, Mrs. Saunders? Welcome.
Record, Chief Erickson
Got
said he'd
the
be
short
half an
straw.
hour.
As I understand it, you're going to cover not only planning, but
I have code, Concom, heritage, planning and zoning, and then I want to speak about the economic development letter. And I
Okay.
have folks here as well. So I'm going to, and I will do them in alphabetical order. So as you work through your book, the first one I'll cover is code enforcement.
At the page,
32?
For the most part, our budget hasn't changed from last year. The two things I do want to point out in the budget is the outside contracts. We have a contract with, or we have a relationship with a contract inspectional service, McCusker Consulting. That's working really well, and so the hope is to continue that, and so we've budgeted to continue that contract through the outside services O/S contracts line. The other thing I want to talk about is the new property maintenance clerk, which was approved, I believe, a year ago. Part-time property maintenance clerk, which has worked very well. It means that in this building boom, and the chief was correct, we have seen construction of a lot of projects that were on hold begin, as well as a lot of new projects. Our contract services can focus on that building, and our property maintenance clerk can focus on the property maintenance issue. And with that, we've had quite some success in moving forward with property maintenance. We've had dozens and dozens of courtesy letters, and actually, let me explain that process really quickly. When we get a complaint, and for the most part, we work off complaints. As time is available, we do drive through select gateway areas of the city and actually are proactive in those areas as far as property maintenance. But for the most part, we move forward on complaint. The property owner gets what we call a courtesy letter. Hey, did you know there's this regulation? It means that you need to, take a look at these sections of your property which are not in compliance. Please contact us within, and we usually give 2 weeks depending on the property or the property owner's location or the extent of the issue, 2 weeks to 4 weeks to get in touch with us with a plan to comply. If we do not hear from the property owner within that time, they get a violation letter. And usually with the violation letter, we cut that time frame in half and we say, okay, now you've got a week or 2 weeks to get in touch with us. If we don't hear from you, we'll go to court. In most cases, individuals will get in touch with us, and we will hear from them, oh, sorry, the house is under construction, or we will be pulling building permits to fix it, or we will clean up that mess, or we will remove those cars. And we say, okay, we'll give you a week to remove those cars. In a lot of cases, we may get one of the cars removed, maybe half of the junk removed, and we need to go back and we form a working relationship with that property owner. In the case where we don't hear from them, we go to court. And we've gone to court several times with this new property maintenance clerk. And I'm sorry the light is not so good. I wanted to show you some before and after pictures of some of our successes. This is a property that's on Sheridan Street. It's been a problem child for probably close to a decade, where we were not in the practice of going to court. Question?
That's all gone.
It's all gone, that's right. And for years, we were sending violation notices, and for years, the trash or the garbage would move, the trailer would move from the front yard to the backyard. And this is what the front of the house looks like now since we've been to court. It's fantastic. This is what the rear of the house looked like. What we were finding was that the rear of the house is actually quite hidden in the summer because the growth around it. So the trash would move from the front of the house to the back of the house. We'd find it in the winter when the leaves came down. This is what the back of the house looks like now. So again, this has been a problem child for close to a decade, something that previous code directors were dealing with that we've been able to take care of since we got that position. On a smaller scale, that one was a large scale. On a smaller scale, this is something that was brought to our attention. I believe this one's in the south end, and the pictures are not exact, but with working with the property owner, this one did not go to court. In working with the property owner, we've got building permits pulled, we've got new siding, new windows, new porch going in, and the house has really been brought up quite a bit. So that position has been extremely helpful in making sure that relationship is consistent and doesn't kind of get lost in the shuffle as we move forward with large building booms, kind of through the ebb and flow of the building construction. That's all I have on code enforcement. I'll take any questions on that before I move on to the Conservation Commission. All right, Conservation Commission. I say this every year. I'm going to say it again. I think this is one of the best investments of your dollar. The amount of stuff that this small board,
Page 39.
Thank you. This small budget leverages is amazing. I have Dean Anson here, who's the chairman of the Conservation Commission. I want to go through some of the projects that just in the last year this group has accomplished. Every year they do water quality monitoring, which is in conjunction with this University of New Hampshire and the state of New Hampshire as well, on both tributaries and open water. And we have that going back several years, so we've got developing trends now where we can see how water quality is across the lake. They participate in United Way Day of Caring, every year. This is a picture from this year where they had the United Way Day of Caring volunteers here out on Black Brook taking care of some milfoil infestation that was really clogging up Black Brook as it came into the bay in the area of the yacht club, Spinnaker Cove Yacht Club. Fantastic program. They've participated every year. This year was a fantastic kind of coordination of a lot of groups. They're working on a milfoil master plan this year. They're coordinating with other towns across the Lake Winnipesaukee watershed. In the long run, we're looking for a full Lake Winnipesaukee milfoil plan. In the short run, we're looking for a Laconia-based plan. Several towns do have plans already, and we are working with them. That will be a project probably for the next year or two. They have a Soak Up the Rain initiative where they're working with property owners to put in rain gardens to try and get stormwater infiltration on site on all these residential properties across the city and not necessarily running off the site down the driveway into the city storm drain, requiring municipal upgrades of the system for capacity. They've been several years working on an invasive species maintenance program at the transfer station, which has been fantastic with Public Works and with Waste Management. This year I know that they had the Boy Scouts there and sort of an interpretive garden and some signage and things like that. They've been involved in public outreach as well and making sure to get out to the public. One of their bigger projects, and this now goes to their budget, is the hydrogeomorphic study of Black Brook. This is the brook that is closest to the city's water intake. It is just upstream of that. It is the brook that was impacted several years ago by the Lowe's development. It has been impacted historically by development along Union Ave and Laconia as well. This study, similar to one that was done by the Public Works Department on one of the other brooks in town, basically characterizes sections of the brook, develops what those functions are, and then what the human-based impediments to those functions are. So, for example, in several areas of this brook, flood protection is part of the makeup of the landform of the brook. That has been impacted by human development, and so this geomorphic study will identify that and then form action items that folks can take to fix that to help provide more flood attenuation. So the natural area can take large rainstorms and it doesn't overtop and wash out city streets and storm drain areas and things like that. This project, this geomorphic study, is quite expensive. It means people out in the field walking and documenting the whole of the brook. Looking at the integrity of some of the man-made systems, the retaining walls and things like that. But it has been a wonderful public-private partnership. We have received money from several private entities that have property on the brook, all the way up through into Guilford, who have put money toward the study. The town of Guilford itself has put several $1,000s toward this study. The Conservation Commission just this year received $15,000 in grants from DES, Source Water Protection. DES recognizes that this study is really going to help our drinking water source. That's what that source water protection is. And so for that reason, the Conservation Commission is asking for $10,000 in this year's budget in order to finalize and finish that geomorphic study. The money that they've got so far can take them all the way up to just about getting the action items completed. And so this will finish that action item list and actually allow them to start implementing some of the bigger action items as well.
That was the grant money you accepted in last week's council meeting from Guilford, and the Concom went out and solicited that and got a favorable response. So credit for their fundraising abilities as well.
So that's all I have on the Conservation Commission. I don't know if there are any questions on that one.
Questions on conservation?
Okay, great. Really quickly, I want to touch on the Heritage Commission, which I apologize is actually not next alphabetically. It's under the Administration Special Items. I have it as page 20. It's probably the only one I do have the page number on. I just want to point out for the Heritage Commission that there's $750 requested in the budget. It's not a lot of money to support the Heritage Commission. Pam Clark, the chairman, would like to have been here today, but she's actually before the ZBA. ZBA chairman also would like to have been here tonight, but he's actually at the ZBA meeting at the Mill. And I know that the Heritage Commission, although they did not really have, were not organized enough to be able to get before the council for a larger request than the 750 this year. I just want to let you know that that is something that they'll be looking at in the future. They really would like to do more outreach and education on historical, the importance of historical structures in the city, perhaps even some inventorying and things like that, and $750 is not a lot of money to work with. So I just wanted to point that out, that where it is in the budget, and that next year there very well may be a request coming your way.
Everybody got that, page 20 at the bottom?
Okay, thank you. Moving on to planning and zoning, I wanted to point out some of the, some of the things that just this year have been approved, and
Page 74.
this past fiscal year, and this goes to the chief's comments about construction. A lot of the residential construction that is occurring has been previously approved. It was kind of put on hold through the recession. The planning board approved extensions to those projects, knowing that really it was not a finance issue with the developer per se, but it was a sales issue. It was an issue with the buyer, and that these projects would be successful projects if the buyers just came back to the market, which we see is happening, and so these projects have been up and running. This year, though, new projects, a lot of commercial construction. So we've got the strip mall next to Dunkin' Donuts, we have Taco Bell, Lakes Region Community College, the fire station, a paintball park on Endicott Street, the 40,000 square foot Tightflex expansion, which is fantastic, the WOW Trail, the self-storage units on Endicott Street, which although was pulled, removed from the planning board agenda the night of the meeting, the planning board staff spent very many months, and planning board members months reviewing that package. Lakes Region General Hospital, the emergency room, and then some new projects and changes to projects at Meredith Bay. So that's really just the last, 10 months or so. So things have really been cooking in the planning department. It's great to see. In addition to all of that, projects before the planning board, we've also worked on the Weirs rezoning, which was several months, and then the early street acceptance, which was several months back, but was several months in the workings as well. The other thing we've been working on, I know you all know about, is the master plan, and this is our master plan advisory committee working in the Mill. They have been fantastic. They have been working now for almost a year and a half on this master plan. We spent a lot of last summer out in the public, really, I hate to say this, but in people's faces, not in this room asking people to come, but out in the community, trying to ask people, what it is that they value about Laconia, what it is that they envision for the future. And because of that, we have a fantastic list of value statements that will be our vision statement, which is one of the required elements under the RSA. We also had our October session at the Mill with with the New Hampshire Listens program, also funded by the Orton Foundation and New Hampshire Charitable Foundation. And then, here's another picture, fantastic turnout, close to 100 people. And then our community open house at the O-Pee-Chee Conference Center, which had just under 100 people, very interactive. People were putting up sticky notes and dots and things, and really helped define that very important set of values and vision statement. This summer, we're moving forward with our natural resources chapter. We have a grant through the Pardo Foundation, which is a follow-up grant to a grant they gave us a few years ago, working with Lakes Region Planning Commission and the Audubon Society to formulate our natural resources chapter. We will be taking that draft out in the field this summer, very similar to what we did last summer, out to the people in the field, on the street, asking them, based on the input we've heard both at the October and the March session, is this chapter right? Did we get it right? Are these the natural resource-based values? Are these the natural resource-based action items we want to move forward with? We're also working on our land use chapter. We just met today, several-hour meeting with Plan New Hampshire. This is a grant that I asked you to help support with a letter of support several months ago. We found out from Plan New Hampshire that we're getting it, and they are going to be coming to the community probably in August to help us do charrettes, one for the Weirs, one for Lakeport, and one for downtown. The scope has been expanded to get us our future land use maps for our master plan, which is another required element under the state statute. And then we've just had our last interview with our economics consultants that we'll be bringing on board. In the next couple weeks, we'll be working on a scoping meeting to also be working on our economics chapter this summer as well. So that's how we'll be moving forward with the master plan. All of that said, we have not asked for any increase in funding in the planning budget. We had in previous years asked for money, or no significant funding. We have a few $100s here or there for increased, like copying costs and car rental and things like that. In the past several years, we've asked for $20,000 a year to help support the master plan. We had $60,000 in savings. It cost us just about $60,000 to do our last master plan because of the fact that for the most part, many of these elements have been grant funded, and we still have a good majority of that $60,000 left. We are not asking for any more money at this time, and we're just going to keep plugging away at those grants and at this master plan under our current budget. And that's what I have for planning and zoning.
Questions?
And then lastly, I wanted to talk about the economic development letter that I wrote to you and the city manager in conjunction with our budget. I want to ask again for your support in, at some point, bringing on an economic development staff person to help this city move forward. I personally don't think that this person belongs in the Planning and Zoning Department. I think it belongs in the Administration Department. That's something for you guys to decide. It's something that we have heard the need for. We heard it very strongly at our October session at the Mill from the public that they want this. I have Pat Wood here from the chairman of the Downtown TIF Committee. This is something that the Downtown TIF Committee supports, and you're welcome to ask him questions about that as well. As they see the needs of the TIF groups increasing, the administrative needs as money comes into the system and as projects need oversight. Although Kevin and I do the best we can, at some point, if we bring on both Lakeport and the Weirs, there's just going to be too much for Kevin and I to handle with these three TIF groups because they are so successful, because we have so many projects moving forward. This economic staff person could work to recruit businesses in. It could work on the marketing, the branding that we've talked about here at the council. It could work on some community development grants. It wasn't that long ago that we were providing grants to residential properties to upgrade their properties and come into compliance with the property maintenance code. We no longer offer that, and so it's a struggle for a lot of these people. A lot of the times when we give people these timeframes, it's because they don't have the budget to fix a failing roof or to repaint their house or to fix a porch that's falling down. And this person can really help with that. So again, I'm making that plea. We've seen that it's supported throughout the community and by groups that work with city departments as well. So I'm certainly happy to take any questions. I don't know if Pat wants to speak on that as well, but.
Councilor Lippman, question?
I just want to let you know that I think it's a strategic mistake for the city to do so. I think we barely support one director of economic development through Belknap Economic Development. I think if we're looking to strengthen our economic development piece, we ought to look at how we can collaborate and leverage off of that as opposed to going off on our own. I think today is witness of the reason not to have it as a competitive process. There are people from all communities, that contribute to trying to make it work for the central city here. So you're pushing up a rock up a hill with me on this.
Understood.
Mr. Wood, you're standing up. With the council's permission, I'll recognize Pat Wood.
Thank you, Mr. Mayor, councilors. I want to say, first of all, thank you all for today, the very special announcement today. I made a little list of some of the things that most of you as councilors have accomplished over the past couple of, maybe the last 10 or 15 years. We have a new middle school, major renovations to the high school, new football, soccer, field hockey field, substantially new fire station, a new police station, a new Main Street bridge, a new Elm Street bridge, a new traffic circle in the Weirs, a new water treatment facility, a river walk, a WOW trail, a new park on Lucerne Avenue, new Gateway Park, reconstruction of a major part of Union Avenue, and now a community auditorium. That's where our community is. We're on the go. We're moving ahead. The TIF districts need help. We have wonderful help right now from Shanna and Kevin, but they have full-time jobs. If we have 2 more TIF districts, we are going to need some administrative assistance just for those TIF districts to do the job that you've asked them to do. So we need that help. The economic development person that Shanna is talking about will fit into that concept, and you may be surprised to hear this, we could probably pay for that out of the TIF money. So there wouldn't be new taxpayer money going into this position, but it would be a tremendous boon to the city as well as the TIF districts to have that economic development person. And maybe it doesn't start out as a full-time position, but it certainly is something that I think, not necessarily to go out and sell our community, I think you all have done a great job of that, but to help coordinate what it is we're trying to accomplish as a community. So we've talked about this at the TIF meeting. We're going to meet again tomorrow morning. We'll talk about it, I'm sure, again. But it is something that we feel is very important for the community in the long run to help maintain some of these things that you have all supported over the years. That's what we're asking for.
Thank you. Councilor Littman?
You know, just so you have some perspective, we've been very fortunate in the region to have one good person, in fact, so good that they were recruited to take, the assistant role at the state level. We barely have one person to work here, and if we're going to do something in this regard, I really can't emphasize enough to not go a separate way on it. It's sort of like, we had a discussion earlier tonight on mutual aid. It's like, be like all the towns setting up their own independent communication systems to accomplish that task. Is, from having served on that board for 9 years and just finished my term there, and the main reason I got involved in city council is for economic development. It would be a colossal mistake to go out on our own and do this when it's really a regional effort. And if we need some help, it's, leverage off the talents that's there and add some more resource there as opposed to within the city itself.
Go ahead.
And I certainly appreciate all of that. And the Belknap County Economic Development Council, I was there at the inception when we first met.
Jane, was it?
And Jane has been was on it for many, many years. I'm a strong supporter, but I believe in it very strongly, and I think that it provides support all over in so many ways. And we're not asking to replace that by any means, but my example as to why I think this is important. 20 years ago when the BCEDC was started, the city of Laconia had an economic development person. That person was on staff as part of the community development program here in Laconia. He spearheaded a group of people that was meeting with the owners of the Colonial Theater to find a way to purchase that. And he had some wonderful ideas to allow them to get some additional alternative property to build a new theater and convey that to the city. And quite honestly, we were very close to getting that done. The county established the BCEDC, and the city council at that time said, well, now we have an economic development person that we can use, and they let the city's person go. The group of people that were working together couldn't maintain that momentum. We couldn't do it ourselves. And we lost that opportunity 20 years ago to accomplish what we've just done now in a fantastic manner. So my experience is that we don't need to work in competition with the Belknap County. We work together with them, but we have other needs that we need to meet as well as a community, and I would support that type of a person. So that's where I'm coming from on it and why it's important to me. So, thank you. Okay.
Thank you.
Thank you.
Thank you.
While we're on this subject, I don't mean to put the, whoops, he's getting them. I was going to ask the city manager, not to put you on the spot, you don't have to answer this question tonight, but we've not had a significant discussion of this at the council level, and it obviously hasn't made your budget, I guess, is the bluntest way of putting that. So what input, perspective can you offer on this?
I can certainly see some value in having someone coordinate with the TIFs and be focused a little bit more, because right now we are hitting a busy period right now on a number of fronts, and staff is being stretched thin. Even when we get a random inquiry in here, and what do you have for available space, and what's the zoning here, and we have on a number of occasions gone out and met with someone who's coming to town and talked about the processes and different things. So to where the downtown TIF is and the projects and what's moving forward today, there could be maybe some dollars in another budget or two for a part-time administrator funded by the 3 TIF districts. I think Lakeport, just based on the size of the district and what's there and the build-out already, probably will grow at the slowest dollar amount. But I think the Weirs in this environment right now probably has the opportunity to jump, really start to take off. And when you heard Robert Ames, I believe last week when he came in and spoke of some projects and potentially doing underground utilities in the Weirs as being one of the things, coordinating how those types of projects tie in with our road construction projects and a number of things. There could be some administrative support in the near future for the TIF funds as they grow. Right now, we're generating almost $200,000 a year. I think it's $180,000 or so rolling in to the downtown in this one. Just what we talked about today with the project that was announced, potential over the next couple of years for that to spur more development here. The Beacon West condos coming on board. So I think it's a discussion worth having, and I hear the concerns, but at least on the administrative end for coordinating and being able to assist. We've got great volunteers, but they all have full-time jobs, who serve on our TIF advisory boards. So someone to help shepherd and something I think is worth considering going forward. I agree, we don't want to compete with an existing entity. If there's a way to support some dollars, into that program specifically towards economic development and separate out some TIF administration elsewhere, something for consideration. And I think part of that's driven by the uptick in the economy right now.
Just to add to what Councilor Lippman had to say, I guess I'm perfectly open to any kind of discussion on the matter in detail. My own personal bias, because I've had this conversation with a number of people in the community over the last year, and my own personal bias is, in terms of using TIF money, so to speak, is I personally hold the belief that the TIF dollars' greatest benefit is to use as leverage for capital improvements. And every dollar we spend on staffing or administrative costs, as opposed to using those dollars to leverage capital improvements to the community, is a dollar lost. And I mean, that's my prejudice that I bring to the situation. If we spend $100,000 a year or $150,000 a year on administration, that leverages one heck of a project right there in terms of debt service.
Are we allowed to use TIF money to pay personnel? I'm not sure that's one of the uses that's in.
I think for administrative support within the district, you can. You could not use TIF dollars to be a blanket person around the city, but to come in and focus on the districts that were designated.
Just on the TIF districts.
Yes, it's an allowed use.
Whereas what we have now is good for the entire city.
Yes, but as you know, Shanna's role and Kevin's role, they're getting stretched thin as we add new parks and potential new buildings to the mix and things. So something for a conversation. And
Well,
I don't.
even with an economic developer, their jobs would still increase if we have new projects, right?
So I think it's a discussion. Obviously, the letter came to us. It's not included in my budget. I don't think it's there now, but I think it's a discussion, potentially somewhere in the future on how we can best maximize our dollars.
Councilor Bounds?
I understand Councilor Littman's position, and there's a good rational basis for that. I understand the request for an economic development, some help in that regard from the planning board. Certainly, at the meetings that the planning department did with respect to the master plan, that was a current theme expressed by a lot of people. And my only reason for saying something tonight is that things are changing, and they may be changing in a very dramatic way for the city of Laconia. And what we're doing in terms of downtown development, what we're doing for development in other areas of the city. And we just ought to keep an open mind about what the value of an economic development coordinator would be to the future development of the city and what an impact it could make on our tax base in terms of new business. It's not going to happen this year in this year's budget. I don't see that. I don't see anybody coming forward with a proposal to do it in this year's budget. But it does have value. It can actually make money for the city of Laconia, and things are really going to change dramatically as we move forward, and we better be ready to change with the times if we need to.
Councilor Littman?
Economic development, it takes a team approach, and what you saw play out today is a team approach, and just don't create a dysfunctional team. Again, when I got involved in city council, because we had a dysfunctional team, not talking about the city, but region-wide, and I think we've come a long way in addressing that, and I fear greatly going back to that situation where you get too many cooks in the kitchen, and if we need help, we ought to try to do that in a coordinated way, not go off on our own. You need someone to supervise someone. Well, you're going to have someone who's supervising that doesn't know anything about economic development. That doesn't make sense.
Don't get me wrong. Kudos to you for
No,
all your efforts.
I'm not looking for
Okay.
anything there on that regard.
No?
We've worked hard as a region to work together as a team, and I think we're finally there. Let's not undermine that, is my plea.
And we still have several more budgets to go through tonight, just a
Yeah,
reminder.
yeah.
Okay, so we'll move on, and thank you to our planning director and our TIF District Advisory Board Chairman and our Planning Board Chairman for coming tonight. Mr. Hutchins, thank you. Thank you all. And so we still have to get to finance and administration, correct?
Yes, we do.
We know it's well
Right.
prepared, so.
Who's up?
Well, I'll let the finance director go. Either close with a bang or close with a bust with me, you decide.
What page?
49, right?
Actually, if you want to turn to page 18, the first thing I want to talk
I'm on
about,
18.
What page?
page 18. and it's the IT budget, which is part of the non-departmental budget. And just want to give you a quick highlight of what this covers. Basically, this covers your maintenance and licensing on all the computers in City Hall and throughout the city, software upgrades, firewalls, virus protection. There's funds in there for GIS, which has been a huge, we've been focusing a lot of energy on that. And it's not only some staffing and so forth, but it's also the maintenance or the licensing costs for that. We have monies in there for replacement of equipment, training, and also included in the budget for fiscal year 16 is an upgrade to the operating system, and as well as hopefully we're going to be looking at an automated timekeeping system which would integrate into our payroll system. Some of the things that we accomplished this past year was we replaced all of our old servers with virtual servers. We invested quite a bit of time and energy in the transition from the LRPA to the live broadcast of the council meetings. All city departments now accept credit cards, whether it be online, in person, or both. So that was a huge project that we rolled out in stages across all city departments. We also provide support to all of these city departments, except for police and the library. They pretty much maintain their own systems. Things that we got going, again, for 2016, as I mentioned, is an automated timekeeping system so that we can reduce the hours that would be spent and streamline our payroll system. We're looking to continue to upgrade our operating system as well as add a few more virtual servers. And another big project that's on the forefront is we have a new welfare application software that's going to be rolling out in the next several months. That's going to be, the system we have is pretty simple, so to speak, and this is going to be a lot more data that it'll be integrated so that if a client comes in and we put in their name, we'll be able to see that they've been seeking services maybe in another community. We won't know what those services are, but we will know that they have gone to other communities. So if somebody is rotating through different communities seeking services, we would maybe make a few phone calls to try to find out what's going on and so forth. But it's going to be a better record-keeping system, but it's a completely different system than what we're using, so there's going to be quite a bit of changes and training that's involved with that. We're also spending quite a bit of time. We just got the fiber to the fire department so that we have to upgrade the server that's over there, and the IT staff will be involved as they move that project along and complete the new building. So there is a slight increase in that budget, and that's pretty much the accounting for it, is the changes that we see happening there. We have 2 full-time people, and their actual salaries are included in the finance budget and not in this line item of the IT budget. Does anybody have any questions?
Go ahead.
All right. Next, I'd like to move you over to page 42, which is the employee benefit page. This particular line item is budget is your Social Security, your health insurance, and your retirement. The Social Security is basically includes the steps and raises throughout the city that have been calculated for all city employees.
So this
except
is not including,
Public Works, Solid Waste, Internal Service Fund, and Sanitary Sewer Fund. The Social Security for those departments is included in their budgets. However, police and fire, as well as the other general fund employees such as City Hall, Parks, library, are all included in this line item.
and what's the rationale for keeping score that way?
Well, the Internal Service Fund and the Sanitary Sewer Fund are enterprise funds, So that is why those are tracked separately.
Yeah.
Public Works and Solid Waste, it's the way it's always been done. To change it would sort of muddy the waters in terms of pulling that for historical analysis.
We had this discussion a year or two ago, and I think the best rationale we came up with is police, fire, and public works being the three largest budgets. It was decided at one point to put the entire cost in there so they could be identified and tracked. When you get into assessing, planning, finance, administration, library being smaller budgets, we're thinking the rationale was just combine the retirement, the social security, and the health insurance for other smaller departments into one. Don't have any better reason than that. That's the way it was when we got here.
It's working, it's working.
Well, like I said, we did talk about whether it was worth the effort to split it out, but that if you try to do a historical analysis, then everything from this point forward would not match up and so forth. But the health insurance is based upon the enrollment as of the current.
It's not an insignificant amount of money. I mean, $1.2 million, right?
No, it's not. It's a large number. And as far as the retirement go, the contribution for the city for the next fiscal year goes up to 11.17% for the general these employees, whereas the police and fire is included in their own budgets, and there are increases in those as well with the retirements figures. Questions? Okay. Moving right along, if you want to turn to page 44, this is the actual finance budget. This includes 9 full-time employees, including 2 part-time, which would be your treasurer who's part-time, and as well as a part-time person in the tax department. The positions included also is the tax department, so we have the tax collector in here and her part of her, she has there's one clerk there whose hours are split between licensing and tax, and that's why there's only 25 hours for that particular person. Also, just keep in mind, there's the overall operating expenses of this budget have increased just under 2%. The amount for postage includes the mailing cost for all the tax bills, and that's why it's such a fairly significant number. The 2 mailings that go out in May and November for the tax bills, those average. And then if there's any delinquent taxes and we have to send out reminders or certified letters because people have not paid their taxes, that's included in there as well. So that's why your postage number is on the higher side. Also included in this is your audit numbers. But other than that, pretty much most of the expenses are fairly routine with no significant increases.
You're going to be
Go ahead.
savings on mailing costs related to registration, car registrations, or that in your budget?
That would be included in the clerk's budget. Every piece of mail that comes through the finance office is comes to a certain department's budget. So this is just the mailing cost for the finance department and the tax department. So when Mary brings up bills for dogs, send out the dog bills or the licenses or car registrations, we charge them to her budget, her line item budget.
And do we use a mailing service at all in terms of, would we consider that? Do we have enough volume to make it worth our while?
I don't think we do, and actually, we're trending away. So some of the, like the property tax bills, we are required to send those by mail by state law. There's not an opportunity for somebody to opt out at this point, I don't believe, and say, I'll take my property tax bill electronically, where they can do that for some of their other bills. So on the elective bills we can, we do have a number of people who are starting to opt out of doing that, and we're doing electronic notifications as often as possible and encouraging as often as possible.
What bills are those?
We're doing that for
Dog license.
dog license, yep.
Car registrations.
Electronic,
I-
email, in other words?
Mhm. If they sign up, we listen them electronically, yeah.
We arrested any dogs yet from that last time?
What I'm referring to is the mail houses where you take your mail and you bring it
Right.
through them, and so you're preparing your mail, it's just that you're taking advantage of their scale in terms of they get a cheaper rate from the post office.
But they get a fee.
Yeah, we get a bulk rate.
We get a discounted rate because of
Are there any
Go ahead.
questions?
Questions on the finance fiscal budget on page 44?
If you would like to turn to page 48, it's the finance insurance budget, which includes the unemployment insurance, workman's comp, property liability, as well as a few other small categories. The unemployment request this year has gone down primarily due to the decrease in the unemployment rates over the past several years. The workers' comp, we have received a premium offset the last several years. In fiscal year 14, that was $122, and in fiscal year 15, it was $30,000. However, we've continued to fund this at the full rate so that it would not have any impact in terms of taking it out of the budget and then having to put it back in. So we've continued to fund it at its full amount. I don't know if you want to speak to the letter that we've received.
Yeah, we just got notification from our health insurance company that somewhere in August, we've got a approximately a little over $40,000 in return surplus from the health insurance pool. Now, a portion of that would have to go back to employee contribution, a portion of that to the retirees, which pay 100%. So it might be something we look to acknowledge before we adopt this budget to capture it as unanticipated revenue, a one-time of our account. We figure the city's portion of that $40,000 or a little bit north of that would probably be in the low $30,000. So, small number, but it's a number to work with. We just got notice of that late last week.
Added to our insurance stabilization fund?
We could, it's not going to come until August, so it'd be realizing that revenue in the budget you will adopt, and then we could shift it over into the health insurance or the unfunded liability for leave time on the books, one of those type of things. But not a decision we need to do tonight, but if we want to recognize it for revenue, we'd want to do that before they adopt the budget, and then the money's coming in August at some point.
If you want to turn to page 50, if there are no questions on the insurance, on the finance principal and interest budget, one thing I'd like to note is that we have $131,000 that we're going to be carrying forward in the fiscal year 15 budget, basically because we budgeted for some bonds that we didn't end up taking out until this fiscal, so late in the year, so we didn't have those bond payments. So, what we're going to do is carry that forward and apply it towards the debt service for fiscal year 16 to reduce the amount that we have to pay. So, but that's pretty self-explanatory. The finance reimbursables on the next page, page 51.
Before you leave that page, there was a correction that,
Yes, I made note of that.
okay.
For the, I did make note of that.
Okay.
We'll have that corrected when the budget's adopted for the final version.
On page 51, you have the finance reimbursables, and basically these are different line items such as reimbursements from Park Association utilities, the reimbursement for the use of the Robbie Mills field, as well as on the police side, gun permits and court fees and extra duty, and it just recognizes these as reimbursables that then go back. The general fund collects those revenues, and then it goes back to the various departments, and this has just been ongoing for years in this capacity. So some of these numbers over the years have been adjusted at the end they were adjusted to reflect the actual. Lastly, if you would like to turn to page 121, I'd like to highlight the welfare budget. And the welfare budget, right now, we have 2 full-time employees. That's page 121. We have a welfare specialist as well as an administrative secretary. We service approximately 400 inquiries per month coming into the welfare department. Those could be people calling with questions, those could be coming through the door, as well as the clients that we see. Our biggest expenses in terms of providing relief is for housing and either electricity or fuel for people's, to heat their house or pay their electric bill. I've decreased the amount of city relief that we are requesting from $90,000 in fiscal year 15 budget down to $80,000 in 85, and then the manager reduced it to 80.
The numbers are playing that way.
Well, we have a very good welfare guideline policy, and we hold people accountable, and so, we go through the questions. And a lot of times, a lot of those inquiries that come in, the staff in there will go through and ask some questions and try to identify. Sometimes people come in here and looking for a service that we don't provide, and we direct them over to either the local community churches or DHHS, or, help them. I mean, Susie does a great job of sitting down with these folks, and if there's some sort of assistance that they qualify for, that they're not receiving, she will work with them. She really will go above and beyond trying to get these folks the assistance that they're looking for, or all the assistance that they may qualify for, even if they don't necessarily qualify for something that the city provides. And we are the last resort, and we are really just there to provide your basic living expenses, make sure you have, a roof over your head, and if it's wintertime, that you have heat. Most of these clients, they qualify for food stamps, they qualify for medical assistance, and really, we don't provide many folks with assistance for medicine these days. That seems to be taken care of through other organizations or because of the health care that they're able to obtain. But in this past year-to-date, we've provided approximately $32,000 in actual assistance to clients. In fiscal year 14, it was 45, and in fiscal year 13, it was 72. So it does seem to be trending pretty evenly, and hopefully that's, because of there are a lot of people out there that still need assistance, and that's what they're there for. But they do have to document what they're looking for, and have to provide documentation of what their expenses and incomes are.
Right. Sorry, I had a cramp.
Do you need assistance?
No, I just have to stand up and put weight on it.
So,
I usually have to stand up a lot longer than that.
No, mine are very quick.
does anybody have any questions?
Nope.
Questions on the welfare budget?
They also work, too, don't they? You still have that policy where a lot of them
Yes, if
do-
somebody comes in and receives assistance from the city, we provided they are able to, we have them do what's called work fare, and it's not very difficult, but they have some type of a work commitment that they have to come in to work off the assistance that they provided, as well as, that they've been provided, as well as a number of job searches, as well as they have to be in compliance with any other assistance that they are eligible for. So if they are eligible for, say, food stamps from New Hampshire, from DHHS, and they don't do the proper paperwork, then we're not going to look to assist them unless they clear up their sanction that they may have with DHHS. But we do require them to do work fare and look for jobs.
Outside work or inside? Is it
It depends. If it's depending upon the client, typically if it's a man, he goes over to Public Works and they have him do some tasks down there. And if it's, usually the women do office-type work here at City Hall. If they have a medical reason that doesn't allow them to do that, or they have child care obligations that would prohibit them, then we obviously take that under consideration.
Administration?
All right, we'll get you back to page 7, and I'll keep going until I hear someone say stop. How's that for a deal?
Stop.
Okay, any questions?
Good enough for me.
Page 7 is the administrative budget. This is my office, my assistant, mayor and council salaries, and the office expenses, telephone, postage, copier, et cetera. So no significant increase on any line items there within that whole budget. Turn your direction.
You
to-
actually went down in economic development.
We did. We had not spent some money there, and we reduced that by a little bit. I'll turn your attention to page 18, which are the non-departmental expenses. Donna just went through the fourth one down, which is the largest component of that budget, which is the IT GIS line item. 2 below that, you'll see contingency. That number was originally in at $50,000. And then we ended up adjusting it, so as you recall, when we talked with the police department, if there was something that they identified as the next step that they didn't have right now towards combating the substance abuse, so we parked $50,000 in there for contingency, so it became a council decision at some point to transfer money over. So if you want to think of that $100,000 in the contingency as $50,000 towards a police need not identified at this moment, but it could be somewhere during the year, and the other $50,000 would just be the general contingency for the remainder of the city budgets. That's the 2 components that was made up of. So if you recall, when Chief Adams was here, you said if you had some money, what could you do with it? And it wasn't an immediate answer until we worked through the Officer Adams expanded role and what it was. So there's $50,000 parked there for a future police need if the council decides to. You're not committed to use it there, but that's what half of that contingent line item is for. Toward the bottom, you'll also see the second line up from the bottom, Lakes Region Public Access. I commented on this last week that I had put $20,000 into the budget because I didn't have any other figures when the budget was put together in March. That number, I think, is just in the $27,000 area, so if we want to make that line item whole, we should adjust that line item somewhere before we adopt the budget to put in, and we have that exact number for you. Turn to page 20. This is administrative special items. These are requests generally from organizations in the community, whether they serve a mental health role, a counseling role, senior centers, transportation, hospice. There's a few miscellaneous items in here for 4th of July fireworks, Chamber of Commerce dues, Wow Trail, Boys and Girls Club. So these are outside agencies who submit their budgets, how they raise their dollars, what level of service they provide to the city of Laconia out of their overall budget. You know, we get a lot of detail from these folks. So last year's budget was $221,000. This year's budget is $229,000. I think you'll see the increase coming from the Wow Trail was $8,000 last year. They requested $20,000. I've got it in at $15,000. And the other increase that was increased by $2,000 was Boys and Girls Club had $5,000 last year. They requested $10,000 for this year, and I budgeted $7,000. So other than that, I think if you run down the lines, everything is fairly much a status quo.
What's the Wow Trail? What do they do? What do we do there?
That was if you remember last year's budget situation, they got some extra money in from us and other sources, and so we reduced the budget down because their annual insurance bill is like around $13,000.
Yeah, it's maybe a touch lower than that, but not too far from that. So they have to pay insurance as required by contract with the state for being in the rail right-of-way and during construction of different things, and it's a pretty significant amount. As Council Lippman said last year, with the council approval of some of the TIF money toward the construction, we reduced that. But again, they're gearing up to go with Phase 2 and some significant costs going there. So based on the request and knowing it's a great city amenity, that's the level that I recommended, but certainly it's up for council discussion going forward.
But I think around the budget table last year, we acknowledged that and made the cut, and then
Yeah.
said we would
Come back the
come
following year.
back the following
Yep.
year.
So that's really the only changes on the page 20.
So Genesis requested $47,250.
Yes.
And did you have a discussion with them about that request?
I didn't have a specific discussion. They submitted their financials and their information to us, and it was just a balance of, we've incrementally increased them. If you look back to the 10-11 year,
Yep.
we were at 8, we got to 15, and we got to 20, and it was sometimes just weighing priorities of where we were at. So a great organization, as a lot of these are.
Is that normal for them to request that much, or is this extraordinary?
No, I think that's a normal request for them, even going back to the years that we funded them at the $8,000 and $15,000 levels. So we, at least in my time here, I brought some incremental, but a lot of them do justify it based on number of their overall client base, if it will. That's to Laconia and how they track and do, and there's some of them that just come down to dollars and cents choices.
So who requested $24,000 for fireworks?
That was something that we tried to get into, and I've worked this with the Parks Department. They're only really requesting 12, but the challenge is they've already signed the contract for the fireworks that will happen on July 4th, yet we haven't approved the money yet. So I said, in your budget submittal, put in 24,000, not that we were going to spend the 24,000, they were still only going to spend the 12,000, but now we would have the money to encumber for the contracts at the end of June for July 4th, as opposed to hoping the budget gets approved and actually spending it, not really in arrears, but they've got to go out and sign the contract with it. So I requested Kevin to put in to do it, because I know that's a concern, that we just want to make sure the funds are going to be there. I promised him that, cutting fireworks is like messing with motherhood and apple pie. It's probably not going to happen. So I said, put it in there, and if there's a way that I can make all the numbers work and leave the 24,000, so we've got it, current budget going forward, I'll do it. And if not, I'll drop it back down to its normal funding level. So he did it at my request for that reason, and it just didn't work to try to double dip it this year, so I backed the 12,000 back out of it again.
Okay. Wow, that was complicated.
I know. So I'll get you to page 64, which is the legal budget. Sorry, 65, actually. We've actually had, and again, you never know what's going to come down the pike at you, just like winter or emergency services, but we're through a good chunk of the negotiator. We've got all the contracts under agreement right now, so I've backed that number off. Our special outside litigation, we've been very fortunate the last couple of years. I've dropped that from 25 to 20. Our outside litigation, again, we're trending decently, so I've reduced that a little bit. And our general retainer for the services with the Mitchell Municipal Group is our ongoing day-to-day. So a relatively very lean legal budget.
Speaking of litigation, where does Elm Street suit stand?
I can't get into a lot of details with you here, but it's scheduled to move forward in the court system potentially sometime in late September, early October, I believe,
To trial?
to trial.
Because we were in mediation, right?
Yes.
And we made an offer, and it's rejected.
That I don't want to get into in
Oh,
a
all
public
right.
session.
Okay.
So happy to have that conversation with the council in the near future, though. But I think it's slated right now for a September, October trial date.
Do we have to vote to go beyond 10, or we,
On a special meeting, we have to extend? All right.
I'll make a motion
Entertain a
to-
motion to extend the meeting by
15 minutes?
2 minutes.
15 minutes?
What do we have left?
How long you got?
Just me, and then the mayor's got a couple of quick
Oh,
items.
that's
I'll do
right.
20 minutes.
Yeah.
20 minutes? You're being generous, okay.
Second,
20 minutes, is there a second?
second.
Second by Counselor Bolduc. Any discussion, all those in favor of extending the meeting by 20 minutes, please say aye.
Reluctantly.
Motion carries. We're good to 10:20.
Okay, so that's legal. Actually, it's down 23,000 from the prior year. So when you looked at the trends, we've gone significantly from the 150, 160 range to the last two budgets, and trending in this budget for a third budget less than that. So I'm not comfortable going any further with that. I'll turn you to page 101. Sorry, page 102, which is records, city clerk.
Really give this one a hard.
City clerk.
Well, that falls under me, so she makes me fight her battles for her. So in this particular area, you will see in some areas where we have reduced expense tied to particularly one line up from the bottom, city motor vehicle registration expense. So we've gone now from not sending the full letter, we're sending a reminder postcard to people right now, which is less expensive, and we're letting them know that they can sign up and get renewals electronically as well, and we've got a number of people shifting there. And by law, I don't believe, and I looked to the clerk for this, I don't even believe we're required to mail a notification right now. So it's kind of the weaning process where we went with a letter and the registration. Now we're sending the postcard that's less expensive to manufacture and mail, and we're saying, please sign up online, but at some point in the future, we can, if we want to, eliminate mailing altogether and put the onus on people. So we are looking to utilize the electronic and cut expenses, but...
Are we, Scott, are we sending notifications for boat registrations that have registered here in the past?
That database is not available to us.
Oh, really?
Only actual motor vehicles. Buses, we don't have the ability to get at this time.
Boats they can register anywhere, whereas a Laconia resident has to do it, so...
Ask them to come here.
But we do put a notice on the bottom of car registrations, or had been, if someone's, mailing it in the spring, saying, oh, by the way, those months from January to May or June even, come on in, and while you're here doing your car, do your boat at the same time. So we're able to put a message on those things, so, anyway. But we're always looking to expand more electronically. But overall, the city clerk's budget, one item in there that I know will come up is in the middle of the bottom section under the records preservation. I won't get into it a lot tonight, but we've got a significant number of city records volumes that we need to preserve, and some of these go back, 80, 90, 100 years, if not further than that.
1852.
And we've got some with just a lot of wear and tear. So we've gone out to bid, we've gotten some prices to do them, we've tried to do a book or two a year to get it, but we really should get these done and up to snuff, and once they're done, the pages are pulled and embossed and protected and all that stuff. So I know the clerk has a request, since you transferred the $200,000 into the non-capital reserve going forward, I just suggested to her that we not muddy the water right now. That can happen after the 1st of July, that we can discuss some non-capital reserve. But there's a significant number of volumes that we are required to preserve, and we should preserve for their historical significance. So there's some that'll be coming forward to you, and we'd be looked to funding it out of the non-capital reserve as an option. So that's the clerk's budget, and I'll move on to election page, which is on page 106. And again, that budget is up a little bit just based on, we are on a primary year.
Yep.
Plus, the increases are in here, correct? That we've done for the people working on
We've
the
adjusted
polls.
the wage increases, and they're factored in, as
Yeah.
well as the extra
Okay.
election cycle. So that's what's reflected in there.
Okay.
And that concludes what I've got for you.
Any questions for the manager?
Where do we go next?
Okay, we have some quick business.
I'm at budget-wise, what's our next?
So next,
Monday.
next Monday, the 22nd, we're scheduled to start at 6 o'clock for general budget discussion. So if you have any department heads that you want present for follow-up on anything that we've done, the school got me a good document late last week that I was out of town for a couple of days, so I will get it in your mailboxes in the next day or two, or I have it electronically, so I'll send it both ways. That answered a few questions that came out of the Finance Committee about enrollment and cost per pupil, so that I will have to you at some point tomorrow. But the school is planning on being here anyway on the 22nd. Not only Superintendent Forston, and I'm assuming...
At 6 o'clock?
At 6, as part of the general budget. The interim superintendent, Dr. Phil McCormick, will also be here with her and whatever other administration and school board members they have coming with them.
That's going to be next Monday?
And so next Monday at 6 o'clock is just general budget discussion. So if you have questions that you want to make sure that we have answers for you from any department ahead of
Where
time,
we might make cuts or additions?
you can come to consensus.
Or are we going to do that later?
It's our first discussion.
Right, you could come to
Doesn't have to be
consensus
the
and see
last
where you might
discussion.
go, and yep. We also have the budget public hearings scheduled for both the school budget and the municipal budget next week. There's not any expectation that you're adopting the budget, but you'll have the general discussion at 6. We'll start the meeting at 7. The public will have an opportunity to comment during the public hearings, And my full expectation is you take no action on it and we move forward to the budget as we had talked about at our first meeting in July, which is July 13th. The state, just to kind of parallel, the state budget is in committee of conference right now on bills and the budget bill. I believe they're targeting next Thursday or this Thursday? A week from Thursday?
Be done to vote on everything.
To be done to vote on the committee conference on the budget. So I think we'll be in good shape if we look to adopt the budget, our first meeting in July, that the state budget will be in place. Based on what I've seen right now on anything on our major revenues being rooms and meals, highway block grants, reimbursements from, wastewater type of DES types of projects, I'm not seeing anything that concerns me that we were over-aggressive on state revenue projections based on where they're at today. So that's kind of what happens next week and then going forward. So again, if you have any specific questions beyond what the school will get to you, I'll get to you from the school tomorrow. Or if you want another department head to come back again, please let me know as soon as possible so we can make the most productive use of your time next Monday night.
Okay, anything else on budget before we move on quickly? Okay. Several items of business under other business to come before the council, all related. First thing we have tonight is, you'll recall that at our last meeting, we delayed approving the minutes of the May 26th non-public session that dealt with the
Colonial.
purchase of property. And so though you have the revised minutes before you tonight, so I would entertain a motion to approve the minutes of the non-public session number 2 held on May 26, 2015 as revised.
So moved.
Moved by Counselor Bolduc, seconded by Counselor Bounds. Any discussion of those minutes? All those in favor, please raise a hand. And those minutes are adopted. Next, we sealed those minutes, and now, since this is public information, it's time to unseal those minutes. So I would like a motion to unseal the minutes of that same session.
So moved.
Moved by Counselor Bolduc, seconded by Counselor Bounds again.
Second?
All right, any discussion of unsealing the minutes of that non-public session? All those in favor, please raise a hand.
Aye.
Vote is 6-0, those minutes are unsealed. Next, we need to schedule a special meeting of the council for June 29th at 7 p.m. And the reason we need to do this is because I'm going to ask you in a minute to vote to schedule a public hearing on determining the public benefit of the Colonial Theater purchase and renovation project. And in order to do that, by voting to hold that hearing tonight, we don't have enough time legally to post the meeting in time to do that public hearing at our next meeting on the 22nd. And we need to do it in time to act in a timely fashion to get the money available to BEDC to close the deal. So if we don't do it on the 29th, we're into the 4th of July and the 13th, and that's waiting too long, especially allowing for the fact that something could go wrong in the posting or whatever. So as a cautionary measure, we're recommending that we hold that public hearing on the 29th. So I'm asking you tonight for someone to make a motion to schedule a public meeting on the council for the night of the 29th, with the assumption at this point in time, the only business would be that public hearing. Moved by Counselor Bolduc, seconded by Counselor Doyle,
What time did you say?
7 p.m.
That would be the only business that we
That would be the only business for that meeting.
That's it?
That's it.
Okay.
Any discussion of scheduling a special meeting of the council for June 29th at 7 p.m.? All those in favor, please raise a hand.
Aye.
Vote is 6-0, and that meeting has been scheduled. Okay, next, we need to pass a motion to refer to public hearing during the June 29, 2015 special meeting under RSA 33:3, the finding of benefit of the Colonial Theater renovation project for the public purposes of redevelopment of an underutilized structure, the benefit of having civic auditorium space, improvements of the local tax base, and creation of employment opportunities. Moved by Counselor Bolduc, seconded by Counselor Bear. All right, so that's the legal language by way of definition, that we posted for that night. We're not holding a public hearing on the loan itself. We've already voted to approve the loan. What we're holding a public hearing on is this declaration of public benefit. Everybody understand? Okay, so we have a motion on the floor that's been made and seconded. Any further discussion? All those in favor, please raise a hand. Vote is 6-0, and that language is approved. Thank you. Any other business to come before the council tonight?
I move we adjourn.
Counselor Bolduc moves adjournment. Counselor Bear seconds that motion. Any discussion? All those in